The African Pharmaceutical Forum (APF), the 5th Regional Forum of the International Pharmaceutical Forum (FIP), presents her 2021 Regional Workshop theme, Technological Innovations for Pharmacy in Africa amidst the COVID-19 pandemic. Date, 31st of July 2021. Time, 11 a.m. West African Time. Venue, Ibis Hotel, 23 Toyin Street, Ikeja, Lagos. Keynote speaker, Dr. John Serbi Mafo, Senior Technical Advisor, Health Supply Chains, Technology and Innovation, Kwame Nkrumah University of Science and Technology, Ghana. Sub-theme Speaker 1, Professor Cyril Usifo, FPSN, Founding Member, FIP, Unit Win, and Professor of Pharmaceutical Chemistry, University of Benin, Nigeria. Sub-theme Speaker 2, Pharmacist Jackie Maymin, CEO, Independent Community Pharmacy Association, ICPA, South Africa. Moderator, Dr. Ariola Joda, FPSN, Assistant General Secretary and Editor-in-Chief, APF. Chairman of the Day, Sir Anthony Akimen, MNI, FPSN. Host, Dr. Prosper Hiag, APF President. Chief Host, Mazi Sam Onwabunwa, OFR, MON, FPSN. President, Pharmaceutical Society of Nigeria, PSN. Nature of Conference, hybrid conference with interpretation in French and Portuguese. Register today. Announcer, Dr. Didier Molium, APF General Secretary.
Thank you very much, and we're all welcome to this event. As I put on the group chart, good morning, good afternoon, and good evening, wherever you are in the world joining us for this workshop. You are most welcome. We're going to be going straight into the event. I'd like to recognize those seated in the hall here today. We have the APF President, Dr. Prosper here with us. You're very welcome, sir. We have the President of the Pharmaceutical Society of Nigeria, Mazi Samo Abua, ably represented by the Deputy President South, Dr. Ejiro Foyibo, FPSN. You are very welcome, ma. We have with us the Chairman of today and immediate past President of the African Pharmaceutical Forum, Sir Anthony Ahimen, FPSN. You are very welcome, sir. Seated next to him, we have the Registrar of the Pharmacists Council of Nigeria, Dr. Elijah Mohammed, FPSN. You are most welcome. At the other extreme, we have the National Secretary of the Pharmaceutical Society of Nigeria here with us, Farm Prince, I like to add that Prince, Benga Falabi, FPSN. You are very welcome, sir. And at the extreme end to him, we have the General Secretary of the African Pharmaceutical Forum, Dr. Didier Molium. You are most welcome. I will continue with introductions as we go on. Please remember that the APF website is www.africanpharmaforum.org. You will find proceedings of this event there after the event. And you will find other very useful information, including the yearly journal of the African Pharmaceutical Forum, the African Pharmacist, on the website. Without much ado, I'd like to welcome the President of APF, Dr. Prosper Hieg, for his opening declaration. You're most welcome, sir. Yes, please come to the podium, sir.
Thank you, Arinola. Good morning, good afternoon, good evening everywhere, all over the world. I'm very delighted to be here with you I'm also happy. Okay, I have to remove my mask. Okay, thank you, Didier. Okay, I was saying that I was very happy and delighted to be here in Lagos for this workshop of the 2020-21 year. I would like to thank first President of the PSN, duly represented here. I would like to thank my predecessor, Dr. Akimen, for taking the time to be here. I would like to thank also my brother, Elijah Mohammed. Thank you for coming. I would like to thank my friend, my very good friend, young brother Benga, to attending this meeting. Thank you for coming. All protocol respected, I would like to invite you to listen for a few minutes to what I'm going to say about this meeting, which is for me a very important meeting in this period of pandemic that the world is facing. Since 2020, the world is in trouble because of COVID-19. People are dying everywhere. Pharmacists are dying. We have lost many of us. I would like to ask you to stand for 1 minute of silence. Thank you. Thank you. What are we going to do today? You have received the program, but I wanted just to add a few words before opening the ceremony. We have chosen two important topics: technology, university, academia, and vaccination. These three topics are very important. Technology. Why technology? Because when you see what we are doing here today, people looking at us, watching TV, watching Zoom all over the world, it's the result of technology. Can we use technology against COVID? It's what we are going to learn today. What are we expecting for our universities? We'll see what we can do. And vaccinations in pharmacies. There is someone who is listening to us, who is the president of FIP, who is very engaged in vaccination in pharmacy. What is being done in our continent, we are going to see that today. All this to let you know that it is a very important event that we are holding here in Lagos today. Having said that, I would like to declare opened our workshop of today here in Lagos, in Ikeja. Thank you very much for coming. Thank you.
Thank you very much, sir. Another round of applause for the president. Before I call on the representative of the FIP president to speak, I just would like to continue a few more introductions. We have our speaker, one of our speakers, sub-theme speaker 2, here with us, Professor Cyril Osifo. You're very welcome, sir. Professor of Pharmaceutical Chemistry, University of Benin. You're very welcome. We have also with us President of the Industrial Pharmacist Section of the FIP, Pharmacist Shola Sholari. I want to rechristen you, sir. You're very welcome, sir. And then we have seated at the communique table a former editor-in-chief of the African Pharmaceutical Forum and currently a member of the editorial team of the FIP newsletter, Dr. Ukamaka Okafo. We're very welcome. So I'd like to invite virtually Lars Ak Sutherland, the president of the Community Pharmacist Section of FIP, who will be representing the FIP president at today's event. Sutherland has extensive experience of working together with the Swedish healthcare sector in improving health and creating a sustainable healthcare system. He has been vice president of the Swedish Pharmaceutical Society and has had a number of executive positions within Apotek AB, recently as head of national customers/new business. Lars Ake is president for the Swedish national project Check My Medicines. He's a frequent speaker in Sweden and internationally regarding the future of healthcare and pharmacy. Please join me as we welcome Lars Ake Sutherland, president of the pharmacy section, to represent the FIP president.
Thank you very, very much for that kind introduction. Dear colleagues, dear friends, thank you so very much for giving me the opportunity to express the views of the International Pharmaceutical Federation at this very important event. My name is Lars-Åke Söderlund. I am the president of the FIP Community Pharmacy Section. And it is my privilege to join the African Pharmaceutical Forum Regional Workshop on technological innovations for pharmacy in Africa amidst the COVID-19 pandemic, with sub-themes as setting up African associations of faculties of pharmacy and vaccinations through pharmacy. The FIP president, Mr. Dominic Jordan, extends his sincere apologies that he is not able to join you today due to his unanticipated travel itinerary change. President Jordan is sending his best wishes for a successful African Pharmaceutical Forum workshop, and he will be following up the outcomes of the workshop very closely. I commend and recognize the efforts, the leadership, and proactiveness of the African Pharmaceutical Forum for organizing this workshop to advance our profession and deliver better healthcare to communities across Africa amidst the COVID-19 pandemic. The COVID-19 pandemic has really demonstrated the value of pharmacy more than ever before. Doors to new and expanded roles have been opened for the pharmacy profession, and living through the pandemic requires a great deal of innovative approaches for the pharmacy profession and the world at large. And FIP has continued to progress its mission to support global health by enabling the advancement of pharmaceutical practice, sciences, and education through adaptive innovations, especially in the areas of non-communicable diseases, prevention, vaccination, primary healthcare, and interprofessional practice and patient safety. With the changing needs of the public and health systems amidst the COVID-19 pandemic, the pharmacy profession needs to evolve with the support of technology and education. Pharmacists are easily accessible and approachable health professionals, and they are an essential part of the provision of integrated, people-centered services in primary health care. And through technological and educational transformations, pharmacists globally are changing their narratives and providing valuable services that play significant roles in improving healthcare and our societies. For instance, there is a surge in telepharmacy technology and adaptive remote learning approaches across the whole globe. The 2030 Agenda for Sustainable Development of the United Nations calls attention to the fact that the spread of information technology, communications technology, and global interconnectedness has great potential to accelerate human progress, for which optimal healthcare is actually vital. And the explosion of technological advances is reshaping the future of healthcare, and pharmacists need to take ownership of these new trends, new technologies, and new logistic models as well. Technology is indeed changing the way we work, including our roles and our environment. Hence, integrating technology into our everyday work, especially in the midst of the COVID-19 pandemic, is of great service to our societies. Technology through telepharmacy and supply chain robotics, for example, can play a vital role in overcoming the challenges of access to safe and effective medicines in the region. FIP, through the FIP Technology Forum and the FIP Development Goal number 20 on digital health, has put greater focus on digital technologies by working across all regions and with expert stakeholders to explore global initiatives in technology and pharmacists' involvement. And consequently, to ensure delivery of optimal pharmacy intervention across practice, science, and education, FIP has aligned strategically through the FIP development goals to advance the pharmacy profession. Global interconnectedness through integrated efforts in the areas of global public health challenges is key to a progressive and healthy society. Immunization against communicable diseases such as COVID-19 is an example of a sustainable solution to overcoming prevailing global health challenges. The pharmacy profession is strategically aligned through the scientific conceptualization of vaccines, the training of competent pharmaceutical workforce on vaccination roles, and the practical administrations of vaccines to the public. And through the Transforming Vaccination Globally, Regionally, and Nationally digital event series, FIP is currently addressing the essential role pharmacists play in saving the lives of millions through the provision of vaccines. Our colleagues in South Africa, for example, and other countries across the globe have successfully influenced government policies towards the delivery of COVID-19 vaccination to their communities. And FIP is committed to support you in your countries for enabling access to vaccines and expanding pharmacists' role in immunization to expand vaccination coverage, and particularly for the COVID-19 vaccines. So safe and efficient vaccination through the pharmacy profession against communicable diseases requires building trust in the public, solidarity across vaccinating stakeholders, and a commitment to eradicate such diseases in our communities. FIP believes and has seen that there is no pharmacy practice without education and scientific foundations, and therefore FIP supports educational and scientific transformations that build on and consolidate these foundations. So successful educational transformation in academic capacity, quality assurance, competency development, early career training, continuing professional development, and innovative research can be achieved by working together, and working together with academic institutions, research institutions, educators, scientists, and practicing professionals within and outside the African region. So partnerships with pharmacy schools, associations around the world has shown the importance of taking actions in solidarity and with trust. And major professional progress has actually been achieved through these associations in the areas of scientific research and educational policy transformation. So the setting up of an Africa-wide association of schools of pharmacists is a substantial way to achieve this collaborative effort of strengthening the pharmaceutical workforce in the African region. And FIP has launched the FIP UniTwin Pathfinder Toolkit to support the entire African pharmaceutical education community in establishing this Africa-wide association. Association. The FIP Unit Win Pathfinder Toolkit is from associations of pharmacy schools across all regions of the globe and serves as a compendium and guidance for setting up new associations for schools of pharmacy. And the real success story post the COVID-19 pandemic era will rely on the unity, motivation, engagement, and support of stakeholders, including national professional bodies, key educational and scientific stakeholders, and individual pharmacists at all levels of practice. As such, FIP counts on every country representatives to take ownership of technological, educational, and vaccination transformations in their countries with the support of the African Pharmaceutical Forum. In 2023, FIP will host a Health Ministers Summit where we will report progress against the FIP development goals to demonstrate the impact of our commitment to action on the WHO Astana Declaration of 2018. With our continuous engagement with the African Pharmaceutical Forum and our partnership for the establishing the Africa-wide Pharmacy Schools Association, I am confident that we will report progress on global health by advancing pharmacy practice and science to enable better drug discovery and development, as well as access to and safe use of appropriate, cost-effective, quality medicines worldwide for good health and well-being through educational and scientific transformations. Long live the profession of pharmacy, long live African pharmacists, and long live FIP. Thank you so very much.
Thank you very much for filling the boots of the FIP president so beautifully, sir. We are grateful for your participation. Moving on in the program, I'd like to welcome our chief host. For those of us that do not know, the Pharmaceutical Society of Nigeria graciously granted the African Pharmaceutical Forum the National Secretariat, and this has been over 10 years now that the PSN has granted the APF a National Secretariat at its National Secretariat. And so we'd like to welcome our chief host, the President of the Pharmaceutical Society of Nigeria, Mazi Samuel Habua, represented by the Deputy President South, Pharmacist Dr. Ejiro Foyibo, FPSN. You're very welcome, man.
The President of the APF, Dr. Prosper, the immediate past President, and our own past President of the PSN, Pharmacist Ahime, our Registrar, Dr. N.A.E. Mohammed, the National Secretary, Pharmacist Fadlabi, FPSN. Please let me stand on the established protocols. On behalf of all pharmacists in Nigeria, I welcome all with great pleasure. I'm speaking on behalf of the President, so when I say I, it's Mazi Samuel Habua. No doubt, the COVID-19 pandemic has changed the world and the way we do things. 2 years ago, this meeting would have been a physical one for all with a full hall. I want to especially thank the APF President and his team for putting this together even at this time. COVID-19 has changed the world, and pharmacy is no exception. The way we practice and the way we do the things that we do as pharmacists have changed and will continue to change. Technological innovation is a new or improved process whose technological characteristics are significantly different from what you do before. So we hope that as we go on in this workshop, we will be able to come up with new ways that we should practice as pharmacists. For PSN, during this pandemic, what have we done so far? PSN has continuously encouraged her members to support patients and also to play a frontal role in this pandemic, though it has resulted to the loss of some members. May their soul rest in perfect peace. PSN also has been advocating for pharmacists as primary health care providers in Nigeria, especially in the role of vaccination, and they're playing key roles as primary health care providers. During the pandemic, pharmacists in Nigeria, and I think in majority of in Africa, pharmacists actually were the go-to places for so many people. The hospital became, a dreaded place to go to. So especially the community pharmacists were the go-to places for so many. PSN is also prompting teamwork in the healthcare sector for the benefit of the citizens. We know we cannot go it alone, so we must work as a team with the other healthcare workers. Also leveraging the skills of consultant pharmacists. This is a fight we have been on for pharmacists who have been trained by the college as consultants. PSN is on the front row to see that the skills they have acquired will be used for the benefits of citizens, be it at the hospital or at the community. Also, rational distribution of drugs being a health commodity requiring experts handling. We know the chaotic drug distribution that we have. I'm sure it's not peculiar to Nigeria. Ours could be a special case, but drug distribution is a big problem, and PSN is trying to play a big role there. We know that unless we come together, the issue of drug security in Africa will continue to be a mirage. So on this note, I want to welcome all of us to this workshop and pray and hope that we have successful deliberation. Thank you very much.
Thank you very much, Ma. We're grateful for everything that PSN is doing for the APF. And we'll continue to rely on your support, Ma and Sir. So at this point, I'd like to welcome the chairman of today's event, Pharmacist Sir Anthony Ahimen, for his opening remarks. You're very welcome, sir. When Sir Ahimen was the president of APF, he was also president of PSN, so he was a double president.
Good morning, my dear friends, and let me stand on the existing protocol that has been established, but especially to recognize my good friend, the current president of APF, all the way from Cameroon, and his team that took over from me in South Korea some years back. I am one of the happiest persons today to be here and to be invited to chair this regional workshop for the fact that the people that took over from me, they are doing well and they are reaching out. From what you can see from the topics that have been chosen, we have speakers from South Africa, from Ghana, and also from Nigeria. And these are people that are people of great repute, and they are going to give us a message from their topic, and I'm sure this will benefit all the regional, all the member countries. But let me state categorically that PSN has been a pillar of APF, the Pharmaceutical Society of Nigeria. Sometime I used to think, and I still believe, that if there is no PSN, maybe APF regional secretariat might not be in existence. It would just be in the air. I recognized that when I was president of APF. I recognized it when I was president of PSN. The effort made by the Pharmaceutical Society of Nigeria to ensure that we have a secretariat that can reach out where all member countries can hook on. Now technology has made it easier. So the word had been brought to a global village, and what used to be very tedious, getting members across, we can reach ourselves, we can talk to ourselves in a few seconds. And therefore, I'd like to, again, to congratulate the current executive for what they are doing. But let me also say that some of this work cannot go without some challenges, and that's why I admire the current ESCO. In those days, we don't have funds. Member countries may not have seen the need to pay their relevant dues, but here we have officers who are sacrificing, willing to move the regional secretariat forward, to reach out to all African countries, all pharmacists practicing in Africa. And that's why today's workshop, we should not take it lightly, we should not take it for granted, because we're here to discuss the future of pharmacy in Africa. FIP, as you are aware, you just listened to the FIP president's speech. He talked to all that in all the areas that we're talking about today, they have some strategies already developed in education, in vaccination, and in technology. And the work we do in pharmacy is that we communicate. Without communication, our job is undone. Particularly those of you who have read PharmD, we do say that without documenting, it's as good as not doing anything. Therefore, when we produce drugs, we also document everything about the drug, the side effects, and all you need to observe. The same way we do our daily job. But communication and technology has made it easier for us that we can reach out to our patient even at the comfort of our homes. And the era of pandemic, or the COVID-19 pandemic, did reveal this, that we can actually work from our homes. We can also support government. And I'm encouraged that FIP has chosen and have pledged that they are willing to support the African Pharmaceutical Forum to develop policies, and that they can also reach out to government of various countries in realizing that we carry healthcare delivery to the doorstep of all Africans. I think this is a big support, and I'd like to thank the FIP president for this pledge. I'd like to also congratulate him for some of the innovations he has brought to bear in APF, in all the regional bodies. We have five regional bodies. Ours was the last to be created, and it went through a tutelage period, and it has evolved, and I hope it will do better with the support of FIP. My dear friends, members of the Fourth Estate of the Realm, I thank all of you for coming for this workshop. I hope that at the end of the day, the communique will be published, that will be far-reaching, and that every person, wherever you practice, will have something to take home at the end of the day to better the life of those that we serve, either in the community, in hospital, or industry where drugs are being developed. Thank you once again for inviting me to be the chairman, and God bless you all. And I wish you a very successful workshop. Thank you.
Thank you very much, sir, for your kind acceptance. We're moving on in the program now. Another round of applause for our chairman as he takes his seat. Thank you. Okay. So we're getting to one of the highlights of today's occasion, which is to listen to the keynote. And I'd like to quickly do a citation of Dr. John Sebe Mafo. He's joining us from Ghana. He's a lecturer at the Department of Supply Chain and Information Systems at the Kwame Nkrumah University of Science and Technology, Ghana. He has a PhD in Information Systems and an MBA in Business Information Technology. He is a researcher and a consultant in supply chain digitalization, information systems, health informatics, big data analytics, and e-learning. Beyond research, Dr. Mafo has been a lead technology consultant and systems developer for several innovative technological-related products in various African countries. Dr. Mafo was the lead technology consultant and systems developer in developing and scaling RX Claim, a health insurance claim management system with big data capabilities for health insurance sectors in Africa. System is currently used by 15 health insurance firms in Ghana and deployed to over 1,390 health facilities across all the 16 regions in Ghana. In the pharmaceutical space, Dr. Mafo has also been leading efforts in rolling HealthCare, a technological platform which promotes, among other things, the use of e-prescriptions in pharmacies and hospitals by patients, leading to patient-centric supply chains. In the fintech space, Dr. Mafo recently led a team of technology developers to develop and deploy GH PostPay, an electronic financial platform with mobile money capabilities in Ghana. The project is funded and supported by the Universal Postal Union through its Financial Inclusion Technical Assistance Facility, FITAF. Dr. Mafo is married to a lecturer whose expertise is in clinical and social pharmacy, and the union is blessed with 3 wonderful children. Please join me as we welcome Dr. John Sebe Mafo for the keynote. You're on, sir.
Immediate past presidents of the AFP, the president of the PSN, the chairman, fellow speakers, and everybody here, all protocols observed. It is an honor for me to be chosen as the keynote speaker for this August event. I must say, some say I'm an affiliate of the pharmacy practice. And in some sense too, I am also into health supply chains. Affiliate because I'm married to one. But since COVID-19 started, it has reached a lot of countries. It has caused a lot of havoc. I would love to start my presentation straight away with where I was when COVID-19 started. So for me, in February of 2020, around there, had to travel to the USA, and we're crossing across different countries. And interestingly, I saw one Nigerian professor wearing a mask that time. Mask had not become the norm. So with one of my colleagues, lecturers, tried to engage our fellow African, and he was an elderly person. And later on, we realized that the old man knew what was coming. Perhaps he saw that the mask was going to be a feature that we are going to live with. And perhaps that was why he was wearing it at that time. We got locked down. To cut a long story short, we got locked down in the US. For a 3-week program we got locked down and spent the next 5 months under lockdown. I had to celebrate my son and my daughter's birthdays over Zoom. Thanks to technology, things were a bit different. So the whole pandemic story has affected everybody. And like I said, my story is no different. Lockdowns appeared. At a point, we needed to try and testing took over. It became a feature and a norm that if you had to cross to one country, you have to send in your COVID test way ahead of time for you to be validated. And this was all in anticipation to try and reopen countries which were totally locked down. Emergency vaccination programs were run, vaccines were produced. But even with the vaccines, just this morning, there is a story raging in the Ghanaian circles where somebody traveled from the UK, has his test, got to the airport. His son did not test positive, but she tested positive. And so we are still in it. There have been waves here and there. All this has brought a lot of untold hardship on all of us. For Africa, this is our story in numbers. So many cases. God has been gracious. We have not experienced large volumes of death compared to other continents. Recoveries are quite also okay. Several tests have been done and vaccinations are underway. Now, this has, like I said, a lot of effect, both positive and negative on us. And being a supply chain, a health supply chain person, I would love to look at these things so that given the way the pharmacy profession is, we have those from the manufacturing all the way to the retail end, so that we see the upstream and the downstream of the chain, how it has affected everybody. So with Africa, Africa imports over 70% of its products from Europe, India, and elsewhere. And as a result of this, factories, especially in China, if we take India, had to go through a lot of issues and had to close itself in just to even cope up with its own problems. Supply chain disruptions occurred seriously in the East. And I must say it is not easy, especially in these times when we have to get vaccines, and Africa doesn't have any manufacturing plant that produces vaccines. So it's really disrupted us. This has led to shortage of pharmaceutical products. Now, the shutting of these factories have led to some rises in basic commodities which are needed for this pandemic, such as masks. In my country, at one point, the mask was being sold, I think somewhere around roughly about, let's say, $4 for a pack. But now it's really been reduced. I think now some even at a point somewhere you go and you buy and some people dash you one for free. We've gone through all of this. Distribution challenges have been there, and one of the earlier people mentioned it. And one of the things which has not been on the descent is an increase in technological innovations, even in the upstream of the chain. In the downstream of the chain, where the pharmacists are and where the retail pharmacies are, reduced visits to the pharmacy has occurred. Pharmacists, like the PSN president indicated, are at high rates. Some have even died out of it. Just a week or two ago, my wife's pharmacy students had to be stopped from going to one of the teaching hospitals to go for clinicals, simply because a number of the pharmacists who are acting as preceptors got COVID, and it affected some of the students. Pharmacies had to become the first point of contact, since hospitals were much scary places to go to. And this led to some stockouts in products, especially resulting from the upstream issues. Even there, technology was still an opportunity and was under ascendancy. So we realized that in this whole chain of issues within the entire supply chain of the pharmaceutical industry, technology seems to be perhaps a light out there that can help douse the flames that we go through. Now, in an interview recently by Minsat, Minsat made a very interesting statement. He said, on the bright precedented impetus for developing health and pharmaceutical services online, what sort of technologies are being developed or are being used in the space? As an information systems person, I rather prefer grouping them. There are so many of them. I've just tried to cover a number of them here, but there are so many of them out there. I'm covering a number of them so that we can be able to know what is out there and what we can go in for. And even where in your country these things are not there, what are the opportunities that become you there that you can take advantage of? So we have educational, communication, and collaborative technologies, some e-commerce technologies. Financial technologies have become a very important component of this for pharmacists. Transportation and distribution technologies, and we have the AI and analytical technologies. So when COVID came, one of the early things that came out was, how do we communicate to each other since we are supposed to be far apart? How do we get in touch with our patients if we need to do this? And really brought about a lot of the technological companies jumping out there to develop a lot of things. So in Cameroon, TeachMePad was introduced. M-Basa was also introduced in Rwanda, and then we had Welvis. Welvis cuts across. Nigeria used a part of Welvis in their COVID-19 journey. What most of these applications primarily seek to do is to do a self-assessment sort of. Now, in the space, some of them qualify as chatbots where you can interact with them. So you pose one or two questions, a response back to you. Some had to use interactive voice recognition systems where they were adapted into different languages for people to understand. And a lot of pharmacists relied on these because you are the first point of contact that patients will come to. Sometimes, most of the times, most of the COVID cases I've seen where people even don't want to go for testing, you realize they come to the pharmacy and my head is paining me, I have a malaria, and normally you see a malaria treated for 2-3 weeks, potentially not going, then you see a potential COVID case in the making. So the pharmacists keep on getting in touch with them. And when these things happen, these chatbots help to educate those individuals way ahead of time, help them assess themselves and get to know whether they have some COVID-19 or not. So these are some of the technologies within that space that are ongoing. M-Basa was introduced in Rwanda, and that was also a wonderful one. Now, we also have the WhatsApp-based tools. It's a chatbots, all right. I want to talk about chatbots. Basically, we are talking about applications that basically allow us to you talk to a device or an AI that is not really a human being, but has been trained to respond to several things. And in that way, when let's say a pharmacy is closed or a place is closed, you are still in touch. People's basic questions can be answered. And so we have U-Report, which has been deployed in a number of the African countries with the help of Gavi and UNICEF and WHO within that space, which tries to answer basic questions. So if you ask what is coronavirus, if you give you a few answers and that. And then we have Precelt, which is also a similar WhatsApp base. Now, one of the things in the technical space we are realizing is that WhatsApp is becoming a mainstay. And thanks to COVID, it is bringing all of us together every time. It is enabling us to be able to talk to each other. And this is one of the biggest places, even post-COVID, I see is not going to go away until perhaps maybe our WhatsApp is replaced by something else. But that is what is in the space. Then we also have the tracking apps. A number of tracking apps have come out. We have Safari in Kenya, where it was deployed in public transports, where drivers are sometimes encouraged to notify that somebody has potential symptoms. You have other citizens also being encouraged to do that through the app. One interesting one also is the one in Morocco, which net sits. And that also looks at, normally what it does is basically it uses GPS and Bluetooth technology and tries to look at the person who has been detected as a case for COVID-19. And immediately it tries to use the phone records of that person and those close by him or her to see how many people he has been with over a certain period, normally 14 days, to see and immediately narrow down the cases when it comes to COVID-19 suspects. Ghana also rolled out a COVID-19 tracker similar to the ones mentioned above. And these are all collaborative technologies and communicative technologies that seek to try to educate and also try to narrow down the scope of those we rope into the networks that are suspected for COVID-19. And the other one, for which reason we are even gathered here, I remember being in the US, I think 2015, 2014, Zoom was then coming up. It wasn't very encouraging. The logo was not even blue, it was orange. And people had not got to know much about Zoom. But fast forward to COVID, Zoom became so popular, so accessible for everybody. At least you had about 45 minutes, 50 minutes of free time to talk or chat or have a meaningful program with somebody. So Zoom became a face of it. In the African space, one technology which I've been involved with is healthcare. And we used it during the COVID time primarily to link up with pharmacies, and it's still ongoing, to link up with pharmacies. So if you are, you suspect a COVID case, it has ambulance services, it has COVID testing services, it has price checker for drugs, it has a number of things, a consulting services. And once you make a request, you are followed up. If a test needs to be taken in your home, an ambulance comes over, they take the tests and then send you the results. And we had e-learning platforms also springing up. And as pharmacists, continuous professional development is key. And CPD Unlimited is one which has been used in the space and is supporting a lot of pharmacists taking their continuous professional development courses in that space. Now, I will move on to the e-commerce technologies which have also come along. We have Ad Pharma for You. Ad Pharma for You is an online space where you can order your drugs online. You go onto the web, you order, and it's delivered to your doorstep. M-Pharma has been in the space from one country to the other. M-Pharma, I think, is currently in about 6 countries. It has acquired a number of pharmacy outlets. Please, I think there's a feedback from one of the participants. Okay, thank you. So we have M-Pharma acquiring some pharmacies in the space, and M-Pharma is one of the companies within the space that offered a lot of services, especially for those having chronic diseases, diabetes, and their drugs are affordable, 20 to 30% discount on a lot of the drugs. In Nigeria, M-Pharma is out there in I think about 200 pharmacies or so. And we have drugstore also in Nigeria, also offering online services for that. E-prescription services, so the healthcare I was involved with offers you the opportunity of typing the prescription or uploading the prescription as an image and it's being validated for prescription-related drugs for that to be supplied to you through a delivery. The other part, which I have seen as a big boost for Kenya and for Ghana and a number of the countries that are into mobile money, and it's amazing. It's so amazing. In Ghana, in 2020, when COVID struck, because we are all under lockdown, the main form of payment was Momo. And so we have the Momo payments in 2020 reaching almost about 68.3 billion US dollars. In Kenya, it was around $47.3 billion. And how do these things work? Maybe for those in other countries who might not know much about the fintech space. Now, we have short codes. Short codes are used, so you type your *165*3#. Amazingly, if you have, let's say, a phone from, let's say, Nigeria or from Ghana, I've been in Nigeria and accessed Momo services in Nigeria to Ghana directly. If somebody needs to get paid, I do that all the time. And it's so easy. It allows you even to transcend and pay for somebody whose drugs, maybe an adult, wherever. And sometimes you can call your pharmacy, especially in community pharmacies, and then he asks you, I accept Momo, and then you pay. And that makes it very simple and easy. It's a simple, easy prompt that the market woman, that the farmer, everybody can use. Everybody can use, no internet connectivity or whatsoever. Then we have those who have carried a bit much more forward into a web-based platform where you have a number of things, especially the online e-commerce companies also making use of it. There is the other one, the QR codes. That's also even much more simpler, far much more simpler. And in that one, you don't need to do any talk. Once you are ready for payment, you take your phone, it scans the QR code, is placed. If you see the one here, it just scans it and payments is made straight, boom. And the other thing also is most pharmacies had to become Momo agents because they were much more in the community and they were accessible and understood and protocols in that space. So this is in the fintech space and it has made a big difference. So you may need to look at adopting some of these technologies. Then in the upstream of the supply chain, distribution and transportation challenges had been there. And I think one of the success stories, in fact, across the entire world has been Zipline, especially for last mile delivery. And Rwanda and Ghana seem to have taken the lead. Nigeria, Kaduna, I think is on. I think Lagos is also coming on board. I think about 3 states have started, and it's so simple, it's so easy. And because of that, they had to do a number of reverse logistics in that space for COVID cases that were ravaging all over. Vaccinations were not stopped. Earlier vaccination, I'm not talking about the COVID vaccinations, but the earlier vaccinations were not stopped. In most countries, these were a big challenge because you had to come directly into contact with people and you had to travel and all that. So drone technology enabled these things to be possible within the space. Cold chain is one area which now I see a lot of the various companies out there and pharmacies trying to equip themselves with. So Zipline, for instance, has actually increased in terms of its ultra cold chain. In fact, I would say that, I dare say that is one of the most prepared to receive Pfizer vaccines anywhere in Africa, where it's sited. Because if you take their drones, take just roughly about, I think, 30 minutes to go for a typical 6-hour journey or that, it will within 30 minutes, it reaches. And most of the Pfizer vaccines, once it gets there and it's open, within 5-6 hours, you have to finish consuming it. Parcel has also been used to monitor cold chain so that it prevents drugs from expiring. Nextleaf Analytics also has deployed some remote sensing capabilities for places that these things need to be looked at in terms of cold chain. So these are some of the technologies within that space. The last of them has been what we all started with. And I'm sure all of us have picked a lot of information from there. And that's the dashboards. And that's where COVID started making sense to many of us. And I know when many see the numbers, they get scared. When you see the numbers, you get scared. Sometimes in my own country, people just put off the mask and immediately they see the numbers rising, check the dashboards and all of that, they start sitting up. And these are tools for pharmacists to be able to monitor and know that things are changing. Therefore, they need to protect themselves and they need to advise patients on what to do, so that if they walk into your pharmacy and they are not wearing masks, you tell them, please put on your mask, and to reduce the transmissions, to cut the transmissions. So these are some of the technologies that have been in the space. What are the implications for all of us in the pharmaceutical space? It is a new norm and it's not going anywhere. If you look at the earlier flu, I think in 1925, one of the things is that it traveled for almost close to about 5 years. And so sometimes when I hear people saying that the COVID is not real, it's not there, it's not going, you read some of the stories from 1925, you realize it's the same happening now. Some people just did not believe it. And it ravaged and it killed millions and millions and millions of people. It has come to stay. So has the technologies also come to stay. Some of the technologies like the Momo payments will not go anywhere. They have come to stay with that. So as a pharmacy, you have to make that one of your main ways of payment. You have to encourage it. You have to let it work in your pharmacy. Adopt it because it will, in the long run, benefit you. It increases your revenue tremendously. People can pay you without actually physically visiting your pharmacy. In the regulatory space, a number of the pharmacists who are in the regulatory space are starting to see new regulations in this space, especially due to the technologies being introduced, data privacy issues, and all of that. So we need to upgrade ourselves within that space. Online growth for pharmacies. A lot of pharmacies who naturally would never have gone online. In Ghana, I know a number of them are not actually on web-based platforms, but have offered phone line capabilities for people to call in for them to do deliveries. So you need to adapt if you need to have that channel of your pharmacy growing. And the truth is that everybody sees that at a point, e-commerce is likely to take over in the long run from the traditional business. Now, to attract investment, some of these new technological innovations, if you don't have it, some investments will never be thrown at you. I've had, as an academician, we are on a number of studies currently that are just offering investments in pharmacies across the country and different countries, just to see how some of these technologies are working in the space. And if you're a pharmacy and you partake, you earn something small. New career paths are coming, and it's going to also become a mainstay in there. So for those of you whose children are coming up, let's not just think just as being pharmacists in a community, but other things are coming. AI is producing a whole lot of different things. The way forward. And though we have had a number of innovations and technologies in the space, there's still room for more. And one of the areas I see, I was in a meeting, I think 2 months ago with the president of Chemonix, and he made a statement which struck me. He said, at that global level, and he said that demand-driven supply chains are his biggest headache. You know, there's a lot of push on us in terms of the pharmaceutical products on consumers. However, if you can determine exactly what the consumer needs, even before he or she arrives at your pharmacy or at the hospital, it will be great. Then you are not pushing, then you are actually meeting demand. And the technologies in this area, especially mobile technologies, are things that we need to look at and explore and jump into. So if you have 1 or 2 studies in that area and it's happening, or 1 or 2, try to partake, because it's going to become a mainstay. There's a lot of funding going in that area. Vaccine passports, vaccinations, and I was happy the PSN president indicating that there is an advocacy, and it's not just Nigeria, but I think across, even in Ghana, some are advocating that the kind of vaccination with COVID is not the normal vaccination with 5-year-olds and all that. It's vaccinating the entire population. And the pharmacist is our first point of call when the hospitals are not ready to receive us and the beds are full and all of that. So technologies that are got to do with vaccinations, applications in that space, please, when they come up, partake, because at a point, your center might be contributing data to airports elsewhere where they need to validate people's vaccinations at that point. I know some countries initially started without the technology, but had to retreat. In my country, it was similar. We made the journey first for vaccination without it. But when we receive our second batch, we realize demand far outstrips supply. And therefore, the only way to go and ensure that you can meet the demand out there is to know who is vaccinated and who is not, who has taken a first dose, who has taken a second dose, and how is a person reacting to it, the adverse effects and all of that. In conclusion, COVID-19 has had a major impact on all of us, especially the pharmaceutical industry. Though challenging in most cases, it has brought in its wake a lot of technological innovations. I've described some up here. And I must say, for competitive advantage, it is only the pharmacists and the pharmacists that choose to be technologically oriented who stay at the top, because our patients are not coming to the pharmacy in the way that we want them, because the basic rule that governs COVID-19 without us having drugs to treat them is social distancing. Even the vaccines are failing in some cases. So this is where I end, and thank you very much.
Thank you so very much, Dr. Mafo. We are grateful for that very incisive presentation that you have just given us. I'd like to welcome the chairman to just do a bit of a summary of that before we begin to take some questions and maybe discussions around this paper before we go on tea break.
Thank you, Dr. Jordan. Just a very brief one. The lecturer has taken us through a very important topic, which is the focus of our gathering here today, that technology in Africa must be imbibed, just as others are doing. He narrated that COVID-19 brought the world to a standstill, and we were not exempted in any way, but that we're lucky that the devastating effect was not as pronounced as we find in other developed countries, where we have large number of people that were positive, but the deaths were very few. But this is nothing for us to sit down and watch, but that we have to rise up to the occasion. But he lamented that, unfortunately, since drug is one of the areas we focus, 70% of what we use in this part of the world is import dependent, and that's a big challenge to us. He talked about the distribution. Healthcare workers, how they were affected, and hospitals, of course, were scared, and we became the first point of call in terms of getting healthcare for the masses, particularly during the pandemic. He narrated that companies have rose up to the occasion and developed some software, some packages. He talked about the examples of Cameroon, the Teach Me part, Rwanda, the embassy, and even in Nigeria. He said interactive voice also was developed by some group in the midst of the lockdown, such that we could reach our patients. As I said earlier in my preamble, that one of the tools we use in pharmacy is communication. And if we can't communicate, a good drug can be useless if it's not well communicated to the patient. So pharmacy rose up to the occasion by developing various tools to be able to adapt. Talked about tracking, collaborative technologies. He talked about the one in Kenya, talked about the one in Rwanda also, and that we need to. And of course, we knew before now Zoom was already there, but it was underutilized. And Zoom has become one of those tools that we can use to communicate, as some of us are doing here today. He talked about the e-commerce technology, that we need to imbibe that. And some countries, again, have done well in this, particularly when we order drugs. And particularly, he talked about the M-Pharma, which allows those who have chronic diseases to be able to access drugs, even at a discount, and deliver the drugs at the doorstep of those affected. He talked about payment issues. That has become a problem. How do you deliver your drugs without getting your money? And he talked about the Momo issue, the Momo form of payment, which many people have imbibed. He talked about the Ghana example, even in Nigeria, and that in Kenya, they've even gotten up to risen up to about 47 billion worth of dollars, and that it's one short way we can also get paid for services rendered technologically. He talked about we also creating values for Momo payment, because some of us became agents of Momo, whereby we got more jobs, we got more revenue, and also increased staff strength. And that's an area we pharmacists should also look at. He talked about the supply chain area. He talked about Luanda example, the Ghana example, transportation, distribution, and the cold chain. Cold chain for our visitors, you must recognize that some of the drugs that we use, particularly those for vaccines, they have to be kept under a very certain temperature, specific temperature. And sometimes they're under 0 degrees. And when the temperature changes, it disturbs and can distort the intensity or the validity of that product. And so, again, people devise various means to look at keeping this cold chain and ensuring that it gets to the patient at 100% efficacy. He talked about the data analytical dashboard, which every country is able to hook on and produce figures that are of the COVID-19 cases in those various countries. So the dashboard, he said, of course, has also given us a very wide view to be able to assess what happens in various countries. Recently, I saw a post in one of the platforms, and somebody was saying incidences in Kenya, incidences in India, and I replied to the person that I have just accessed the internet, and that is not correct. And we need to also look at this dashboard issue to be able to give us a certain accurate position of what happens in various countries. He talked about what are the implications of this COVID-19 to us as healthcare practitioners, particularly pharmacists, and that it has brought a lot of challenges to us. And we are also aware that that also will mean that regulatory areas also needed to think with us and adapt and adjust and innovate. That means some countries we may need to develop some tools. We may need to, I'm happy the Registrar of our Pharmacists Council is here, meaning some of our laws might need to be amended to suit this new, because how do you dispense an ethical drug online without the implication of documentation, etc.? He said these are food for thought for those of us that are in practice, particularly in Africa, and that we need to reach out to government and ensure the regulatory space is properly regulated, and it's not void and it's not abused by those who seek it to get what they need. He talked also about we need to adapt the e-commerce. Of course, the e-commerce will be the way out. Then the way forward, he said we should demand for the supply chain system. Determine what the patient needs before they even come to us. That, I think, the industry is already doing. That, I also think some of us in community pharmacy, they are doing. You need to reach out to your patient online. They need to place an order, and before they come, you already have taken note of all the implications. Then he talked about vaccination. Vaccination, he said we should advocate for it. And that the issue of vaccination goes beyond just taking that jab. That keeping the cold chain is an essential tool. Pharmacists are better placed to do this than any other person. I remember those days when I used to work with some local government. We know sometimes they might not have generator. Pharmacists volunteered in the community to offer their generator to ensure that the cold chain are in order, such that the people get the drugs at the right temperature, at the right time, and that it is not compromised. He demanded that we should look at the issue of supply chain and their effect. In conclusion, he told us that COVID-19 has brought a lot of challenges to all of us, but like the healthcare practitioners, and that we need to adapt some of these tools and innovations that are on board, and that we should not be left out from other continents. But that there's competitive advantage in doing this, and that we should reach out and ensure that we take occupy that space and ensure that our patients get the right drug at the right time. Thank you. I hope I've been able to give you a short summary of the speech. Thank you.
Thank you. Excellent work, Mr. Chairman, sir. Thank you so much. So the floor is open for about 10 minutes of discussion, questions. If we have questions for our speaker, is online. And Dr. Mafo, I hope you will be with us online till the end, because there will be a longer discussion segment at the end where we would be expecting more contributions and all. So at this time, I don't know if there's anybody in the house that has a question that they want to ask. Any hands up? Any contributions? Yes. There's a hand up, I know, on the virtual. Please. Okay.
Okay. Yeah, thank you very much. And I want to congratulate Dr. Mafo for a very, very good keynote address. My question, incidentally, is directed to the Registrar of the Pharmacists Council. There is a lot of enthusiasm about vaccination, and the case for pharmacists being part of it has been very, very well made. But my worry has always been, what is the state of the regulation and of the statutes? Are pharmacists allowed to do it? And I ask this because vaccinations can be very fraught, you know. People can break down in anaphylactic reactions. The needle can go the wrong way. And if this happens, you know, what would the law say, you know? If a doctor or a nurse makes a mistake while injecting somebody, I mean, they can reduce it to professional misdemeanor. But if you are not supported by law as a pharmacist and you do it, it becomes a criminal liability. So I'd love to know the opinion of the council on this.
Okay, do we have any other questions before the registrar answers? Okay.
Good morning, good afternoon, everybody. And thanks to our keynote speaker for the wonderful presentation. Yes, I still also have a question for the registrar. Yes, the presenter made mention of several online platforms for pharmacists to latch onto, and that COVID has actually exposed the profession to. The issue of online pharmacy practice in Nigeria has not been actually made forward, has been stated clearly. And the chairman also stated that some laws will be changed. So I want to ask the registrar, what is the preparation on how far has the council gone in trying to amend or bringing up some laws to accommodate online pharmacy practice and prescription and also sales of drugs? Thank you.
Thank you very much. Before I go to the registrar, I think I'll take the questions on the virtual platform. So Zita, please, you can unmute yourself. I would really appreciate it if you could write your full name so that it can be properly captured. But please unmute yourself now so that you can ask your question. Or Sylvester Adeyemi, if you can hear me faster.
Hello, I heard my name. Good afternoon, everyone.
Yes, please, go ahead.
Can you hear me?
Yes, we can hear you. Please go ahead.
Okay. It's just an honor to be with you this afternoon, listening to this wonderful event happening in Africa, particularly in Nigeria, Lagos. So my congratulations to those who organized this. I've just listened to part of the lovely lecture given by Dr. Mafo. Actually, I just want to say the hands up must be from your system, because I see another hand up there. I didn't raise my hand.
Oh, wow.
Yeah, that's okay. Now you're giving me the opportunity to greet everyone. Do it right now. Maybe if you have the time.
You're very welcome there.
Sure.
Okay. No, you're welcome. We're glad to have you. If you could even show your video, it will just make our days very perfect.
Oh, okay. I'll do it. Only it makes the bandwidth.
Just for a few seconds so we can see you.
Okay.
Oh, yeah. You're welcome. I will give you opportunity later in the day for your keynote address. I have received it. So you will get an opportunity for your goodwill message, for your goodwill message later. Thank you and welcome. Sylvester Adeyemi. Bye. See you later. Sylvester Adeyemi, are you there for your question? Or am I the one that raised your hand up too? Which I can't really do. Okay, please go ahead.
Yeah, good afternoon, colleagues. My name is Sylvester Adeyemi. I'm a young pharmacist in Abuja. I currently work with, although I'm a pharmacist, but I currently work with Data Lead Africa.
Can you please put on your video, please? Can you put on your video?
No, I can't put on my video now.
All right, no problem. Go ahead then. Go ahead.
Yeah, I work with Data Lead Africa where I provide support to research. I have two questions here. The first question is directed to the speaker, Dr. John. I listened to his presentation, which was indeed very great, and he mentioned a lot of emerging trends in pharmacy practice at the regional level and even at the global level. So my question to him is regarding e-pharmacy practice in Ghana and the regulation guiding pharmacists involved in digital pharmacy and e-pharmacy. So in the Ghana context, Dr. John, is there any regulation, and what has been some of the major lessons that you've learned if you do practice e-pharmacy? And then the second question is directed to the registrar of PCN. I've heard that some of the questions that were being asked basically were about the laws, the current regulatory framework for e-pharmacy. So the question for the PCN is that when developing the law, for example, this digital pharmacy law, what is the plan? Is there a plan for having a robust stakeholder engagement that would help Nigeria develop a practical guide that is implementable within a Nigerian context? Thank you.
Raised there in my remarks that will be coming on later, but I identified two things. One, the issue of vaccination, and then the other one of online pharmacy. Right now, as regards the online pharmacy, we've made all the necessary preparations. The regulations to guide online pharmacy is with the Ministry of Justice, and they are yet to gazette it. Once it's gazetted, we'll now reach out to stakeholders on how to go forward. Although we have been receiving applications, and the applications are being filed, because when there is no law, there's no crime. So the regulations have to be in place for us to be able to carry out our regulatory activities. And secondly, we are already interfacing with the Interpol, because Interpol will be very, very important in regulating online pharmacy. because the online pharmacy may not just be restricted to Nigeria in operation. So if we have to deal with them, then we have to call in the Interpol to pull down and do arrest. So I think that's the little I need to say for now, but I want to assure you that the Federal Ministry of Health and its regulatory body, PCN and NAFDAC, we are set for the online pharmacy practice in Nigeria. And I want to assure you the Nigerian people will be better for that. Then secondly, the issue of vaccination. Pharmacists cannot go on vaccinating now because there's no policy document on that. And we are also working on that. And we have had a series of meetings with National Primary Healthcare Agency, who are the pivotal agency of the federal government to supervise that. And we believe by the time we finish harmonizing our positions, we should be able to come up with a policy statement that will be taken to the Federal Ministry of Health for adoption. And once it's adopted, then pharmacists can be officially covered to carry out vaccination. Because if there's no policy statement, policy document on that, and you start vaccinating, when an anaphylactic shock comes, it will also, the shock will also go into your pocket and probably take you to jail. So we need to put things in place so that the anaphylactic shock will not shock anybody. I think I will reserve other comments to my goodwill message. Thank you, and God bless.
Thank you very much. So I'll now go to the keynote speaker, Dr. Mafo, for the question by Mr. Adeyemi. And there's also a question on the chat. Let me just read it out to everybody here. Question for Dr. Mafo. What is the general level of uptake of technology by pharmacists broadly? That question is by Dothan Moyo on the chat, as well as Mr. Sylvester Adeyemi's question, which was on essentially asking about the regulatory environment for pharmacists in vaccination and online digital, so for digital pharmacy in Ghana. Those are the two questions for you, sir.
In the Ghana case, the act that seeks to regulate this whole thing is currently before Parliament. At least I was consulted on it during the drawing of the bill towards that. Now, one of the things that in that particular one happens is this, and that's for monitoring. Very, very important. Very, very important. And so what in that one happens is that there is a central hub. Okay, you cannot, with a bill once it's passed and it comes out, you cannot operate an online pharmacy without what technological we say you have an API key and a set of other things. So for every transaction that you would do, it has to route through a central hub or a central database system, right? So that it can be monitored. And I remember the council person who just spoke. People need still to be regulated so that if it becomes necessary, Interpol and all that can follow. In the case of Ghana, that is the key feature out there. And it was picked out of how other countries have developed their online space in that regard. So if you don't have your regular license that you renew, it's just like having a normal license for a community pharmacy. So even if you're a community pharmacy or you are a wholesaler, and you just want to go online, you have to register for that particular service online, and you'll be given a particular key and a particular license ID that can be followed and can be tracked. And all your transactions will be monitored so that if you are doing anything untoward, they can come in and be able to digitally, first of all, alert you before they do a physical follow-up to make sure that you are conforming. Other than that, if you leave it in the space like that, we will have a lot of issues, a lot of fraud, whole lot of things in this space. So that's a Ghana experience. Jordan, over to you.
I believe that is, thank you. Answer the two questions in one, because I think both questions were asking about the Ghana experience. Did you answer the question on, let me see what's the uptake. Yes, the uptake in Ghana.
The uptake. So generally, reviewing the literature, I've been reviewing the whole digital pharmaceutical space for quite some time. I have a number of students working on some things within that space. And what we realize is that in Africa, the uptake of technology by pharmacists is specific Ghana, Kenya, South Africa, and Zambia also a little bit. You see, most of these countries are much far advanced. However, the other countries are far behind, are really far behind. And perhaps maybe to the APF, it is important that maybe APF can take up and try out of this to be able to educate and bring some of these countries along. Because when things like this, like the COVID happens and there is no technology and all that, the US people had to finish, they finished the semester, they are beginning another semester, yet a number of countries have not even, in Africa, have not even moved on. Some are still trying to just catch up. And so we need to bring everybody along because we are a region and we need to work together to bring the others along. So that's the state of it currently as I see from the literature.
Dr. Mafo, for your contributions. We'll be breaking. Okay, President has something to say.
Thank you, Arinola. John, good afternoon.
Good afternoon, sir.
Okay. You remember that I visited the zip line 2 years ago when I was in Ghana for the Congress, the PSGH Congress. I was very, very surprised by what I saw with Sena Awiti when we went there. But I want to ask you something. You talked about two countries working, Ghana and Rwanda. What is the regulation? What is the law covering this activity, which can become dangerous for the security of the country, using drones? Maybe in drones you can have many other things, but how are you sure that with drones you will not have any problem of security?
Okay, great. So in the Ghana experience, what happened is, and I'm doing a paper currently trying to publish it with Professor Ndobedu in University of Texas. And one of the things we realized was that if you take the zipline case, regulation in Africa is a little bit relaxed compared to the US. That is why the drones seem to take off in that space easily. But what the Ghana success really is that the aviation authority, right, came in at the fore to do the necessary assessments, looked at all the various things, and actually they treat the drones like every plane flying in the country, just that the altitude is different. Even any one of those drones move up, communications are made, data is sent, they are aware that a particular drone is flying, it is in motion, it is gone, it has returned. And what Zipline did was, Zipline has a lot of dashboards with them, and they monitor these drones in real time as it's happening. I mean, we've had a few cases, and Sena is here, Awiti is here, had a few cases in Ghana where 1 or 2 drones went down, and immediately they located where it went down, followed it up, brought it in, and all that. So it is very important that before these are done in other places, the aviation authority comes in, because everything that flies out there, they need to be aware of. They need to know where it's going, where it's moving from, where it's ending, what its contents are, and all of that. And that is something which will allay the fears when it comes to the security. Because like in every aviation space, we have ground permits, we have overflight permits. So you can't lift anything at a certain altitude without an overflight permit. And that's why they need to send that data and receive their permits before they allow it to fly. Just that most of the time, these things take place through digital means. And once you provide the aviation authorities with the relevant dashboards to monitor in real time, I think for most countries in Africa, we should be fine.
For that, it's really enlightening, the information that you have shared with us today. So we'll be going on a short break, and while we're on that break, I'll be recognizing the people that are on the virtual platform. So I believe it's time for tea break, and I'm wondering where the hotel people are. Yes, there's virtual tea. Everybody should enter their kitchens and make their tea and drink. Yes. Here. So on the recommendation of the chairman, we're actually standing up and stretching our legs and going to the tea. The tea is not coming to us, so that we can use that to stretch some legs, and so for 10 minutes we will do that. In that time, I will be recognizing those that are on the virtual platform. But just a minute, let me find the hotel people. Please, if you're online, the President or Secretary of the National Pharmaceutical Association, please could you indicate so that we can recognize you? I can see Dr. Dennis Awiti, Secretary of the Pharmaceutical Society of Ghana. You're very welcome. I'm sorry, I only know very few people, so if you're online, I welcome Dr. Samuel Adekola, the National Chairman of the Association of Community Pharmacists of Nigeria. You are welcome. The Vice President of African Pharmaceutical Forum, Pharmacist Jocelyn Chiva, you're welcome. We're missing you here, Jocelyn, we're missing you here, seriously. I can see the National Chairman of the Association of Industrial Pharmacists of Nigeria, Pharmacist Ignatius Anuku, you're welcome. Please, you have to identify yourself because I don't know everybody. Or I'll just go ahead and recognize everybody. Pharmacist Mabel Torongo, the Foundation President of APF, you are very welcome. We're pleased to have you with us. Inaugural President of APF, you are very welcome. We're glad to have you. Pharmacist Yinka Zubai, of Pfizer, you are very welcome. Professor Noah Wanang, you're welcome. Immediate past Secretary General of the West African Postgraduate College of Pharmacists, and he's representing the President of the West African Postgraduate College of Pharmacists, Professor Cecilia Iguilo, in this meeting. Professor Mbangfemi Oyewo, you're welcome. Chairman of the Board of Fellows of the Pharmaceutical Society of Nigeria, you're welcome, ma. Professor Oluwatoyin Odeku, you're welcome. Dean of Pharmacy, University of Ibadan, you're very welcome, ma. Dr. Shere Meku, you're welcome. Department of Clinical Pharmacy and Biopharmacy, Faculty of Pharmacy. If you can just put a small description in the chat box, then I will be able to identify you better. Oh, we have a student with us. You are very welcome. Ndati Mana Duedom, pharmacy student at the University of Rwanda. Wow. The next generation. You're very welcome. Excited to have you with us. Farmside Kebe from the Gambia, you are very welcome. Dr. Abdi Karim Abdi, East Africa, and currently a lecturer in Turkey, you're welcome. Tea break is just for about 10 minutes. We have about 5 minutes to go. Dr. Mafu, I believe you are still with us. If you could please check the chat box. There's a question there for you. If you could please answer it on the chat box, it will be most appreciated. Thank you. Yeah. Pharmacist Oluwafumike Shokpen Iman of the West African Health Organization, you are very welcome. Thank you for joining us. Dr. Khalid Gaba Mohammed, Department of Pharmaceutics. Bayero University, Kano, and one of the assistants to Gonzalo of FIP. You are very welcome. Thank you for joining us. Margaret Blake, hospital pharmacist from Jamaica. You are very welcome. Ewere Eseka, Edo State, Nigeria. You are welcome. I'm excited that we have a good representation across the country here with us. Across the continent, sorry. At this point in time, we have 85 people online. And then there are some people on Facebook and some joining us on YouTube. 400 on YouTube. Wow. Pharmacist Margaret Chibututu, I can see you. You're very welcome. Retired military pharmacist from Lagos, Nigeria. Thank you for joining us. Despite the initial challenges you had with technology, we're glad to have you. Grace Mbuva, you're welcome. We're glad to have you with us. Dr. Oluwatoyin Ojo, Pharmacy Department, Lagos State University Teaching Hospital, you're welcome. Pharm Desben Philomena, Young Pharmacist Group, Plateau State, Nigeria, you are welcome. I'm excited with these students and the young pharmacists that are here. It means that APF has a future. Abbas Sani, GSK, Nigeria, you are welcome. Pharms Prof. Paul Lalvani, Director General, Empower School of Health, Geneva, a sponsor and partner with APF, you are very welcome. Pharmacist Muhammad Hadiya Ismail, serving corps member at National Board for Technical Education Medical Center, Kaduna State, Nigeria, you're welcome. Ogo Rosalie Ijomone, oh, that's my student, an MSc student at the Department of Clinical Pharmacy and Biopharmacy, Faculty of Pharmacy, University of Lagos, you are welcome. Ishaku Daniel, intern with PCN, you are welcome. Monica Agu, Pharma QA GMP expert, Nigeria, you are welcome. Pharm Alison Etukapan, Nigeria, FIP Educational Partnership Coordinator, you are most welcome. Pharm Cassian at Mahuni, Zimbabwe, Harare, Zimbabwe, you are welcome. Pharm Iyola James, PCN State Officer, Edo State, you are welcome. Abdulaziz Salahuddin, Pharmacist, Oyo State Hospitals Management Board, you are welcome. Yes, I know you are civilian, but I like to call you military pharmacist, Pharm Chibututu. Pharm Gloria Okoma, you are welcome. While I go on with that, I would also like to continue the introductions of people in the hall that I am yet to recognize. I recognize, not in any particular order, Pharmacist Shakirat Adeosun, Director of Pharmaceutical Services, Lagos State Primary Healthcare Board. You are welcome, ma. I recognize Pharmacist Habertson, Ebere Habertson, of the National Institute for Medical Research, Yaba, you are welcome. I have not recognized my dean, who has been seated here for quite a while. I think I must have job with oil company since I didn't recognize my dean. I'm very sorry for that, ma. Professor Gloria Ajayi, you are very welcome, ma. Dean, Faculty of Pharmacy, Unilag. In fact, Today's her last day as dean. Today's our very last day as dean of the faculty. You're very welcome, ma. Thank you for honoring our invitation. Yes, ma, we should extend it. Third term agenda. Elections are done and the new dean will start on Monday. Pharmacist Gbolagade Yola, PSN Lagos State Chairman, as well as Coordinator Board of Fellows Lagos, you are very welcome. Past National Secretary, PSN, you are very welcome. Thank you for joining us. Pharmacist Lawrence Ekato seems to have stepped out. Lagos State ACPN Chairman, thank you for being here with us. Thank the press and the technical crew for the work that they are doing here today. In another 2 minutes, we'll be going on with the presentation. I'll be starting off with Professor Lalvani. So please, Professor Lalvani, please be on standby for your presentation. In another 2 minutes. Pharmacist Loye Akomalafe, sorry, I'm so sorry, I didn't recognize you. You are very welcome. Thank you for joining us. So I think when the crew is back, we are back too. See if there are any other names I've not recognized here. From Daniel Ebune from PCN Abuja, you're welcome. Pharmacist Jambo Piri, Zimbabwe, you're welcome. From Ugu Christopher, addiction pharmacist at Federal Neuropsychiatric Hospital, Yaba, Lagos, Nigeria, you are very welcome. From Mrs. Antonia Aruya, Director, Inspection and Monitoring, Pharmacists Council of Nigeria, Abuja, you're welcome. From Dothan Moyo, Past President, Pharmaceutical Society of Zimbabwe, you are welcome. So, I think we're all back to our seats. We've exercised, we've stretched our legs, exercised our mouths as well, and I think we're ready to go on. Yes. So can we go on, please? Can the music go off, please? So we'll just quickly welcome a sponsor, one of our sponsors for this event, the Director, Empower School of Health, Professor Paul Lalvani, to give us a brief presentation. And I'd like to welcome him virtually to the event. After him, we will have the President of WAPCP give her welcome address, give her goodwill message for 5 minutes, and then we'll have the Registrar of the Pharmacists Council also give his goodwill message for 5 minutes before we go into the sub-theme 1. So please, get ready for the next ride. Professor Lalvani, please.
Lalvani, can you hear me? Let me try again. Good afternoon, good morning. It's Paul Lalvani. Can you hear me?
Yes, we can. You're welcome. Please go ahead.
Wonderful. Thank you so much. So once again, fellow pharmacists, a very warm welcome. And let me also mention that Empower and myself personally, we are APF's greatest fans, a partner and a sponsor. And our mission, our organization's mission, is to transform the way pharmacists learn, work, and save lives. And we bring digital learning, and I'll show you some of our innovations that we are doing along with African Pharmaceutical Forum. Next slide, please. So just to change things up, we'll kick off with a 60-second video. If I could ask the organizers to just click on that. Harjeet, go ahead. If we're having, Harjeet, I don't see the video playing.
It has
Maybe
to be
we
played
move on
from
to
your
the next
end,
slide
not
then.
from this end.
Yeah. Harjeet, can you click play? Okay, here we go. It's supposed to have sound and music, but you can't hear it. It's okay. The main messages are there. Jointly building the capacity of African pharmacists. We've set up a collaborative learning platform, especially during these times of COVID, to make knowledge and information available to more than 100,000 pharmacists to promote career growth. And we bring accredited online courses from ranked universities in areas of public health, supply chain, directly relevant to pharmacists. And information, please contact us. Information on this shortly as well. Wonderful. Let's move on. It's usually more exciting with the music, which you weren't able to hear, but we'll send you the link. In fact, the link will be posted on the APF website as well. Just a little bit of information about Empower School of Health. And I see many of you are some of our graduates and alumni. And to mention that His Excellency, the former president of Ghana, is our supreme mentor, guide, and has been instrumental in supporting us in leadership, not just for pharmacists, but across public health. Next. You can read what's written there, but what I wanted to mention in this, as I mentioned earlier, I am a pharmacist, but more than that, with my pharmacy background, reached the highest pharmacist in the Global Fund, managing over 100 countries with a budget of more than $1 billion. And this was about a decade ago. Worked with many other organizations and UN agencies and international NGOs. And with a pharmacy background and a management background and a public health background, it gave me the tools to really make a massive difference. Next slide, please. So our team is, we have a lot of pharmacists in our team. We have doctors, nurses, but beyond that, and especially in this world, and as we move forward, we have to be multidisciplinary. So our team also includes engineers. We include software engineers. We have, in addition to that, individuals working in graphic instructional design. How do we train people? How do we set up systems for large-scale training? And as you can see, our partners and funders range from multiple donors, academia, UN agencies, private sector entities. Next, please. And we don't do this from outside. We're headquartered in Geneva, but everything we do, we partner with our organizations, which include pharmacy associations, national councils, ministries of health, and top-ranked universities across Africa. As you can see on the current slide, this really helps bring scale, brings national capacity, in addition to other activities, something similar to what we are doing with the African Pharmaceutical Forum. Next. So my favorite topic is, how do we become a global pharmacist? And it's a question many people have asked me. How did I end up? I grew up in Nigeria, I grew up in India, I studied in the UK and the United States, and spent a lot of time in Geneva with UN agencies. And the question people ask is, how did I become a global pharmacist? With my initial training, which was in manufacturing, I worked in a hospital and a clinical environment, and even in retail, none of which was satisfying enough for me. And I went on looking for alternatives. And this was more than 25, 30 years ago. Next, please. So understanding global health, first of all, we all know we're in a crisis right now, and we're addressing it. And the role of the pharmacist is paramount to being able to address this challenge. If we compare all these pandemics to the previous ones we've had over the last few hundred years, the current, and I keep that arrow that I'm pointing at, which I updated today, is moving higher and higher. And in the last year and a half, it has gone from being nearly at the end to now with 4.2 million deaths, one of the highest burdens. And if we look at it, death toll per month, it's even higher. Next, please. But as we move forward, it's not just pandemics and communicable diseases. The main death toll is coming from non-communicable diseases. And this is a WHO document where we look at the predictions of diseases and mortality and morbidity, and everything that's going up is NCDs, from cancer to diabetes, whereas what's going down are infectious diseases. So we need to adapt, we need to learn. And while we're facing this massive challenge, we also need to look ahead. Next. And the key role that we pharmacists play in R&D and research, in delivery, implementation, in dispensing, is antibiotics. And as you can see, most of the discovery of antibiotics took place in the 1940s, 50s, and 60s, declining in the 70s and 80s. And the last 20 years, as there's a discovery void. And we need to be extremely careful how we dispense, how we use antibiotics, which are used willy-nilly across many countries, developed and developing countries. There's abuse. Don't have good alternatives, leading to mutant superbugs. Next. So in this SDG era, as a pharmacist, where can we intervene? What do we need to learn? Where can we work? How can I expand my career opportunities nationally and globally? Next. So we put together a series of topics and courses along with APF. And this is just a list, a sample list and I'll zoom in, and many of these are done jointly with the UNDP or with the Global Fund. Many of them are free of cost, some of them are paid, some of them are sponsored by donors or through scholarships. There's an entire range of options. Depending on your needs by pick or your financial limitations, there's lots of options. We cannot stop learning as we move forward. Next. Just highlighting, spotlighting 4 courses. The first one, which is the postgraduate diploma in global health procurement and supply chain. There are several supply chain courses and some very good ones. And there are various institutes and associations that provide that as well. What we do differently, our courses are built jointly with pharmacists, doctors, international donors, and the supply chain experts coming together to build these courses. We do this in English and French. All these courses are available in both languages, and in many cases, the Francophone countries are being left behind when it comes to content, learning, and capacity. And we make an effort to bring both English and French, and more Portuguese as well. Another short course is the International Careers in Global Health and Supply Chain. And this was by request and by demand of our learners and students and workers who wanted to know how they can become, understand what the opportunities are and how they can join them. And a new one that we've started recently, and this was also support, we are working with WHO across Southeast Asia, and we've designed and developed and adapted this course for the African environment as well, which is fundamentals of procurement and supply chain of COVID-19 commodities, of PPE products, of drugs, vaccines, devices, diagnostics, all of them. There's so many moving parts and it keeps changing on a monthly basis. Next slide. So just briefly to showcase to you what the APF Empower website looks like. So this is a landing page. We have your senior folks, your leaders, APF folks are visualized there as well. The academic, professional, academic partners that we work with to build these courses, and then options of which courses you'd like to take, which include, as I mentioned, free and paid. So it's not just about the paid ones. Everything is there for you to access. I think that's the last slide. Next, please. So with that, I'd like to thank again APF for this opportunity, congratulate the organizers, and wish all the attendees the best for this particular regional forum. Thank you very much. Organizers, I give you the floor back if there's any Q&A, or just let me know how to proceed next.
Directed to you, I would let you know, Prof. Thank you very much for your presentation. And then we will be moving on from there right now. I'll be inviting Professor Noel Wanang, immediate past Secretary General of the West African Postgraduate College of Pharmacists, to give the goodwill message one on behalf of the President of the West African Postgraduate College of Pharmacists, Professor Cecilia Iguelo. Professor Wanang, please. Is Professor Wanang there? All right.
Thank you very much, Dr. Joda. I sincerely appreciate the organizers of this great workshop. I appreciate APF for this wonderful job. My name is Professor N.N. Wanang. I am the immediate past Secretary General of West African Postgraduate College of Pharmacists, also the chairman of the Faculty of. I speak here on behalf of Professor Cecilia Iguilo, the president of West African Postgraduate College of Pharmacists, who incidentally is not in the country. Herself and the SG traveled to Togo for another meeting. Ordinarily, they would have been here for this workshop. Well, WPCP is a specialized agency of West African Health Organization, WAHO, and is principally responsible for the training of pharmacists at the postgraduate level to become, and having known the importance of workshops like this and the significance of its growth in the professionalism that we have today, we sincerely congratulate APF for this wonderful workshop, for the organization of this training. There is no better time than now, and it is actually apt to discussing technology, and the keynote address speaker has done a fantastic job on it. It wasn't the wrong choice at all. WPCP had used him in the past, and he gave us very, very excellent recipe. And I'm not surprised that today he gave another excellent presentation to this. I congratulate APF, I congratulate the organizers of this great program, and we look with APF for more conferences, more organizations. We also want to collaborate with all West African countries, the Francophone, the Anglophone. We come together. We pray that opportunities like this will create a bridge between the Ang and the Francophone. With this in mind too, on the 5th of August, sometimes next week, we are going to have a meeting with the Francophone countries, and we will also send a link to this house so that all of us can join in, and then join into this meeting for the success of West Africa and pharmacy profession at large. On behalf of West African Postgraduate College, the President and Council, I congratulate you once again for a fantastic work, and long live pharmacists, long live APF, and great is our profession. Thank you, and remain blessed.
Thank you very much, Professor Wanang, for that short and sharp goodwill message. We appreciate you. I'd like to now call on the Registrar of the Pharmacists Council for his goodwill message.
The chairman of this workshop, I would like to stand on the existing protocols. I'm delighted to be invited as a special guest of honor at this great and resourceful event that seeks to explore, promote, and sustain technological innovations for pharmacy in Africa amidst the COVID-19 pandemic, among others. Over the years, technology innovations have impacted positively on the lives of millions of people across the globe, industries and institutions. The pharmacy profession is no exception. It has the potential to shape the nature and values of pharmacy practice with implications for professional roles and jurisdictions. The COVID-19 pandemic, with its consequent prevention and control policies, has compelled the world, including Africa, to intensify technology-enabled remote management of patients, despite the challenges of inadequate infrastructure and interprofessional teams. These technological innovations include secure web-based platforms, which enable pharmacists to access patients' information, including hospital discharge information for improved care, electronic prescribing systems, with automated prescribing, supply, and administration of medicines. Barcode medicine identification, which helps in proper and easy identification of medicine to reduce error. Automated dispensing, which enables pharmacists to focus on more clinical roles and responsibilities. Use of mobile telephones, text alerts to remind patients that repeat prescriptions are ready, or to offer services. Telecare, which involves the use of digital communication technology, both audio and visual, to provide healthcare consultations and services to patients remotely at home. Information technology is no longer a futuristic term. We see it daily, changing and disrupting different sectors and industry, including health. It is therefore necessary that pharmacists in all aspects of the practice adapt fast to the new realities of improved practice through the application of these innovations. As a regulatory agency that operates in line with global best practices, the Pharmacists Council of Nigeria has put in place various technological innovations in place to improve regulatory efficiency and for the benefit of the public. In collaboration with some internationally recognized NGOs, the Council has designed digitalized quality assurance, quality improvement tools on PCN key regulatory processes. Assessment tools for all areas of pharmacy practice has been digitalized, and some of them are already being implemented. This, in addition to the completed nationwide GIS mapping of pharmaceutical premises, which is expected to improve quality inspection activities and facilitate decision-making. The PCN has also upgraded its website and the ICT systems for optimal performance. A new and robust regulation on internet pharmacy services has been developed, and the Council, in collaboration with the Nigerian Interpol, to ensure regulation of this online site is in progress. The pharmaceutical sector ranks very high in Africa in terms of technology, quality, and range of medicine manufactured. Therefore, improvement in pharmaceutical sector, particularly in the areas of technological innovation, will invariably cause a drastic growth in national development. I wish all participants a very fruitful deliberation, and thank you. God bless.
Thank you very much, our registrar. We are grateful for the innovations that the registry is bringing on board to enhance pharmacy practice in Nigeria. And I know that it will also serve as a base or a template for other African countries to emulate. So moving on in our program, we're reaching another highlight. We want to listen to our first sub-theme, and I'd like to ask Professor Cyril Osifo to stand while I take his citation. Professor Osifo was born on the 20th of February, a couple of years ago. He obtained his BPharm degree from the Obafemi Awolowo University, Obafemi Awolowo University, Ile-Ife, 1979 to 1983, MSc from Sussex University, Brighton, England, in 84 to 85, and PhD from Westfalen Wilhelms University, Munster, Germany, from 1988 to 1992. He joined the services of University of Benin in 1993 and was promoted professor in 2003. He was head Department of Pharmaceutical Chemistry from 2003 to 2005 and Dean of the Faculty from 2006 to 2010. Professor Osifo is a recipient of international and national awards, and to mention a few, we have the Sir Adam Thompson Scholarship from the UK, German Academic Exchange Service DARD, TED Fund National Research Grant, and the 13th edition of the May and Baker Professional Service Award for Excellence in Pharmacy in 2017. He's a member of several local and international societies, co-founder FIP UNESCO Unit Twin Centers for Excellence in Africa, and once served as chairman of this center. He's also a member of the WHO FIP Expert Group on Substandard and Falsified Medicines for Nigeria. Professor Osifo is a former chairman, Edo State Pharmaceutical Society of Nigeria, former editor-in-chief, Nigerian Journal of Pharmacy of the Pharmaceutical Society of Nigeria. He is a fellow of the Pharmaceutical Society of Nigeria, as well as a fellow of the West African Postgraduate College of Pharmacists. He is, in addition, a fellow of the Nigerian Academy of Pharmacy. Professor Osifo is happily married to Dr. Mrs. Stella Osifo, another pharmacist, an associate professor and acting head, Department of Pharmacy and Clinical Practice, Faculty of Pharmacy, University of Benin. In addition, Professor Osifo is the father of a pharmacist. Join me as I welcome Professor Osifo to the podium for his lecture. His pharmacy is breathing pharmacy.
The chairman and the president of African Forum, all protocols duly observed. I'll be discussing with us setting up African Association of Faculties of Pharmacy. Africa is a very beautiful continent, and it's always a thing of joy when one recognizes that one is from that particular continent. And I must say that being an African is a thing of joy. You can stand the cold weather, the hot weather is also not harsh to you. A little bit of background, we have in Düsseldorf we were able to have a syndicate meeting in the FIP, and we started a discussion among some African countries. Ghana was one of them, Nigeria was one, Namibia, Uganda, and Tanzania. And it progressed as we visited one or two countries to discuss a few things on how to assist ourselves, particularly in education, as FIP saw the need for faculties of pharmacy. We needed to harmonize our curriculum, and apart from that, to know what is going on in each other's state. In 2016, precisely in Windhoek, on the 18th of May to be precise, in Namibia, at a dinner interaction, we found out that there was really no African Association of Faculties of Pharmacy. And so we discussed among ourselves, and we found out that if we were to have such an association like this X-Ware, we'll be able to share innovations, we'll be able to share best practices, and we'll be able to organize and have robust debates on the future of pharmacy education and many other activities in pharmacy. The Center of Excellence in Africa it was actually an avenue, or is still an avenue, for free and open exchange of ideas, forming collaborations and partnerships, sharing what works and what doesn't work, and fostering research and education. In one of our visits, we actually found out that in Malawi, some of the persons who were actually staff, the workforce in Faculty of Pharmacy, they were expatriates coming from New Zealand, coming from Germany, coming from the UK, and we started questioning why we couldn't, exploit the workforce in Nigeria, for example, other countries like Ghana. I easily offered that. I'm sure if I call on Professor Gloria Ajayi, the outgoing Dean, Faculty of Pharmacy in UNILAG, to spend 3 weeks in Malawi, she won't hesitate. There were also other opportunities, and as we started looking inward, we had an opportunity of discussing with the final year students, and they were quite impressed with what we were having in our countries, and we were willing to share what was going on in Nigeria. Nigeria, as you will agree with me, had so many schools of pharmacy, and the number keep on increasing. I'm sure the registrar will correct me. I'm sure we have over 27 recognized and registered faculties of pharmacy. And so the Center of Excellence continued, and we are still working on that. But let's look at the possibilities and value and some overview of some associations of faculty of pharmacy. In Latin America, we have the Ibero-American Conference of Faculties of Pharmacy. We have the European Association of Faculties of Pharmacy. We also have the Asian Association of Schools of Pharmacy. And I think myself and the president of the African Forum, Pharmaceutical Forum, Prosper, will be on the 15th of September, will be speakers at the Asian Association of Schools of Pharmacy. We also have the Indian Association of College of Pharmacy, and of course the Association of Faculties of Pharmacy in Canada. And lastly, the American Association of Colleges of Pharmacy. There are many, but I just decided to pull these ones out. But we didn't have an African association. But I know that there are regional associations, and there are associations in various countries. About governance, we would, the European Association of Faculty of Pharmacy, they have the executive, normally elected president. They also have the vice president, the general secretary, and other members. The Asian Association of Faculties of Pharmacy have an executive secretary appointed. They have board of directors also elected, and they have the president and president-elect, secretaries, treasurer, immediate past president, members, honorary advisors. Is quite robust and wide, observers and organizing coming for annual meetings. Again, it's like what NAPSA is doing in the United States, where you have a president and you have a president-elect understudying the president before he or she takes over. Who knows? Maybe we may begin to change the landscape in our Nigerian system, where a president-elect may come in and understudy a present president, so that there will be continuity and cross-fertilization of good ideas. We have Indian Association of Colleges of Pharmacy, the president, the vice president, secretary, treasurer, members. They are institutional and individuals. And for the Canadian one, we have board of trustees, which are normally elected. We have the president, we have the vice president, and members, and so on and so forth. And lastly, the American College of Pharmacy have an executive vice president and chief executive officer that's normally appointed. And you have the president at the board that are elected, and committees are also appointed, but this on volunteer basis. If we observe carefully, I gave an acronym for African Associations of Faculty of Pharmacy, AAFP, but that is not sacrosanct. That can easily be changed. Trying to go forward. Those things might have to come in. I moved backward. Thank you, Toyin. Now the mission, in my suggestion, in my humble submission, should be able to participate and discuss both nationally and internationally around organizational criteria, training resources. We should be able to also prepare study plans and programs, relations with the health system. We should be able to talk about exchange programs, pharmaceutical research, also in general, all matters concerning relevant training of pharmacists. We should be able to formulate proposals and general recommendations regarding the training and exercise of pharmaceutical profession before the competent bodies in different countries. Again, here comes the importance of our, in Nigeria, of our registrar, who is always our regulator. Then we should be able to disseminate knowledge, idea, and points of view related to the teaching and research functions of faculties of pharmacy, or similar issues. And then among lecturers and health professionals, the association, government agencies, students, and general public, we should be able to perform permanent and continuous analysis and critical reflections on principles, methods, programs, and lines of development of pharmaceutical education in African countries, both at the undergraduate level and postgraduate level, and also continuous education for teachers and students. This becomes very relevant presently the COVID-19 pandemic or incidents that we have, we see that there is something very relevant, making sure that technologies are deployed so that we are able to bring to bear what our students we have. I listened to my colleague in Ghana saying many schools of pharmacy have lost, that's quite true, lost a session or semesters or months as the case would be, but some others didn't because they were able to deploy technology for educating their students, and we're able to even carry out some continuous assessment online, and the semester needed not to be shut down. Finally, we established links and normal relationship with associations for similar purposes. Again, in general, we expect the structure and membership to be one of the things for the key successes of setting up this African Association of Faculties of Pharmacy. We need sustainability. There is no need forming an association where there's no way to sustain it. And I would expect sustenance to be one of the key things that should be discussed among members. Then we also need to also discuss member services and finally engagement. This is important because we must discuss with us the cross-fertilize ideas and know the needs of our colleagues. One thing I didn't point out, we discussed at the end of the day, there are some hindrances. I could just mention them. One is language. Very, very crucial. And the other thing is everybody holding tight to what he has. There's more likely regional or country membership being tightened and making sure that this particular South African faculties of pharmacy becomes a thing that we need to bother ourselves about. But one thing is very obvious, that we need this, particularly when we look at the student body. There is an association, even IPSF, we know that very well. And the students robustly are doing quite a lot about that. There should be no reason why we shouldn't be able to look at ourselves and formulate things that will go. Setting up this association will be one way of educational partnership. When I was dealing with WHO, WHO, talked about harmonization of curriculum and curricula across this West African sub-region. We had difficulties with the Francophone group, but somehow we were able to come to an agreement and we were able to harmonize the curriculum based on the FAMD program. And that has taken off in many West African states. We must also be able to facilitate academic networking, sharing of ideas, innovations and expertise, and also advance pharmacy education and healthcare. The purpose of this association, among other things like I mentioned, will be to harmonize curriculum, teaching and learning standards. That becomes important if we want to produce graduates who are globally competent and locally relevant. We also believe that if we have this harmonized curriculum, it will enable persons who probably will finish in Togo to be able to practice in Nigeria. It might provide opportunity for those who finish in Nigeria to be able to practice in Mauritania or practice in South Africa, and probably in South Sudan as well, on a lighter note. There will be better utilization of limited resources because you will have a pool of examiners. When we started this in the Center of Excellence in Africa, Namibia, for example, were able to draw well by asking some of us. I became an external examiner for some of their exams, like in Malawi, I was an external examiner for 3 years. I also had 6 professors in some countries, let me not mention their name, and so that we will not divulge some of the things that we shouldn't. But at the end of the day, countries that didn't have the workforce that was robust or needed assistance, they could easily pull from other countries. And then equipment and teaching facilities become very important. I want to say that during the pandemic, I was to examine a famous candidate, an MSc candidate in Zambia, but there was no way I could go to Zambia. And we used Zoom, and the student was examined. I sat in the comfort of my study, and we examined the students, and we agreed on the score, and the student got her MSc accordingly. The standards were maintained, and because of that huge successes, I decided to encourage a colleague of mine who is Vice Chancellor in Oka, Professor Zimone. Maybe they had it in mind before that, why don't we examine students virtually? We must deploy this technology to assist us. I'm also happy to say that that was done as I had 2 students to examine, and I think they actually deployed the technology using Team, not Zoom, and we were able to examine students without moving anywhere. Again, it was cost effective because you didn't need to travel, you didn't need to stay in a hotel. It was also beautiful security-wise, and at the end of the day, it was a win-win situation. We'll be able to create a network for students and staff mobility, and then we will be able to create thematic centers of excellence for common use and for teaching research, particularly in specialized areas like pharmaceutical analysis and pharmacogenomics, and use of technology for teaching research, online courses like we mentioned, and emerging technologies like telemedicine. In addition, we could have career development, curriculum review. We could also have co-supervision of students. We could provide international platform for uplift of pharmacy practice and training. For younger faculty members. A little break. Okay. 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 Oh, no, it's okay. Okay, fine. Back. Okay. So we were on the structure. We just finished the mobilizing funds for younger faculty. For me, it's very important because as a mentor, I believe that it's time will come when you will leave the stage, but you must prepare somebody to take over whatever you are doing. It's not surprising that I call a mentor or a supervisor as, in the Nigerian term, a traffic warden who directs people where to go. And if you're doing pretty well, it doesn't intervene. But if you're not doing pretty well, maybe you're moving so slowly, it tells you to move faster. And if you're moving too fast, it will tell you to slow down. And so it's important that these younger faculties are also taught how to write research grants, are also encouraged to write research grants because without funds, they cannot really do much work. Then we should be able to lobby financial support from government. The structure and funding, we need to have a governing council, like I listed in other associations. Some have executive vice president and CEO, some have elected, but we need to sit down and ask ourselves what we want. But it should be regionally balanced. And then we should have a secretariat for the day-to-day running of the affairs of the association. Funding should be from membership subscription by member pharmacy schools, also from research funds, and even conferences when organized should be source of funding. For sustainability, I would suggest self-generated funds, clinical research funds, and linkages to pharma industry. Just now in Nigeria, the National Association of Pharmacists in Academia and the Nigerian Association of Industrial Pharmacists have formed a very good linkage and working closely together so as to be able to, that partnership is producing something during the recent conference. I'm sure we can learn from that and leverage from that to assist the schools of pharmacy. The activities, I believe, should involve organizing annual conference meeting on pharmacy education, establish a peer review journal which enhances networking and capacity development, establish a steering committee made of representatives of faculties of pharmacy, which is secretariat and working office, engage stakeholders and benchmark for other associations. We should be able to lift the profile, therefore, of faculties of pharmacy to a world-class level. There must be visibility. If you go online, you just probably will not be able to see faculties of pharmacy online. You're looking for a particular school. You won't get that. But I must say, a university, state university like Niger Delta University, the faculty of pharmacy is well represented on the web. visibility is important if you want to gain prominence. We must provide free and open exchange of ideas on pharmacy education. If somebody requests your lecture note on a particular topic you have expertise, you should be able to provide that. And when necessary, deploying technology. Why can't I give lectures from Benin, University of Benin, for example, to a school in Ghana or a school in Ivory Coast, as the case would be, or in Kenya, because I believe I have the expertise. I should be able to assist so that we can exchange ideas. And then provide platform for joint advocacy on matters of pharmacy and professional and institutional advancements and collaboration. I believe if we do this, like we say in Nigeria, as men of honor, we will join hands. Thank you for listening.
Message was very well delivered. I'll have the chairman quickly do a summary for us. Please, I don't think we clapped for Prof, did we? Please, let's do it again. Thank you very much, sir.
I don't think they clapped enough. Please, can we give him another hand of applause? Thank you. Thank you, Prof, for the very passionate paper you just presented on setting up the African Association of Faculties of Pharmacy. Prof took us through the paper that the background was that in Düsseldorf in Germany during the FIP, there was the need, he saw the need for faculties of pharmacy in Nigeria, in Africa to come together. And this crystallized to what they call the Center of Excellence in Namibia. And ever since then, the talks have been on, and for them to have a center where information can be disseminated and among them. He cited the examples of other regional bodies, the European body, the Indian, Canadian, and etc., where they have this very strong association within those regions, and at FIP they do meet, share notes, and compare notes. But he discovered that that was non-existent in our continent. And that's why this passion to set it up. He gave also the structure, the executive structure of what those bodies are and how they function. But he took us mainly to the mission for setting up this body. Primarily to exchange programs, research, compare notes, and disseminate information, and both at undergraduate and graduate level. He cited the example of COVID-19 challenge, that many schools could not continue lectures, and some students lost some sessions, let's put it that way, during the lockdown. But the involvement of technology in this sort of area in education helped a lot in reaching out to these students, in ensuring that those lectures were still delivered. He talked about the sustainability of this kind of association. It cannot go without some challenges, but he cited some barriers. Major barrier is the language, issue of language barrier, and the refusal of those other faculties to share ideas, to share knowledge, and to share whatever they do that others are not doing. And he said this is an impediment, and we need to overcome that. He talked about educational partnership, the need to harmonize curriculum. It's also very key as part of the mission, because you do not train a half pharmacist. Pharmacists must be trained to meet international standard. And there is need, therefore, for these faculties to have a network, academic network, to advance knowledge, education. Teaching and learning should be the focus, of course, so that they will produce pharmacists that will meet international standard. And he talked about using technology to also teach. We save costs, as had been exemplified in recent times, where I belong to the West African Postgraduate College of Pharmacy, and I know recently we conducted exams online. Research work were examined online. I mean, we give a student 10 minutes, please present your research work, and we interrogate it. We will know if you didn't do the project, and ask questions, and they came out very strongly. We saw the need to embrace this, and we didn't need to travel. In the comfort of my home, I could do such, and many other lecturers, which he said, this can be canvassed and utilized. There is need also to share equipment, those who don't have. And he also talked about the issue of career development, curriculum review. And then we need to also, this body, we need to lobby for the weaker ones. I was just telling somebody recently, just a few minutes ago, that we observed when I was president of APF that some countries do not have legislation at all for drugs. This is true in Africa. This I can say because I was there and I interacted with WHO, UNICEF, all of them. So we need to help the weaker ones that might not even see the need for this kind of association. In Nigeria, this is doable, Ghana is doable, but what about those other smaller countries that might have 1 or 2 pharmacy schools? And so there will be need to muster a kind of resources for them to get some research grants. The way forward, this body should have a governing council. And he emphasized regionally balanced. And I could see that from what we did today. Guest speaker today from Ghana, somebody from Nigeria, and somebody from South Africa. So while setting up this body and mobilizing for this body to be set up, there will be need to be conscious of the fact that it must be balanced in such a manner that you don't pick all the officers from one region and leave the other ones, including the Portuguese-speaking Africans. They needed to be included. He talked about also funding. They need to be self-sustaining. Therefore, there will be need to charge members of this association to self-sustain themselves by generating form of levies. And there will be need also to meet annually to compare notes, conferences that might be rotated in those countries. And this can be done. He emphasized there is need to create a website. And this is doable. Again, the advantages of this are numerous, to specialize a platform and also create just advocacy. And that this, I believe, when this association is formed, we take the African region to another height and ensure that there's harmony and harmonization of curriculum in this part of the world. Thank you. I guess I've been able to give a resume.
Thank you very much. Before we go into the second sub-theme, I would like to quickly call on Mrs. Azubike Okwo for his goodwill message. Mrs. Okwo, a 5-minute goodwill message. Mrs. Okwo, please. If he is not online right now. Okay.
Hello.
Okay, all right.
We can hear him. We can hear him. Hello, good afternoon. I'd like to welcome everybody to this very important seminar. And let me also welcome the president of FIP, who is here with us virtually. Occasions like this reminds you the unique nature of the FIP. 100 years counting, representing over 4 million pharmacists and pharmaceutical scientists across the globe. And I think that one of the greatest achievements of the FIP is the creation of this regional forum, a platform for professional cooperation. The European Forum was created in 1992, followed by the America 2000, the Southeast Asia 2001, West Pacific 2001, East Mediterranean 2002, and the African Forum, which is our own forum, in 2004. 2004 is like yesterday, 70 years counting. And I'd like to salute the courage of our current president, Dr. Prosper. I know it is not easy. I recall when I was president of APF, and we had a meeting in Congo, Brazzaville, and I had to commute from Nigeria to Congo. I left Lagos on a Sunday, got to Gabon. On the same Sunday, waited 3 days in Gabon for a flight to Congo. So I left Gabon on Wednesday, got to Congo, we had a meeting. I waited again 3 more days before I could return to Nigeria. So it took 7 days. Meanwhile, if I was going to Europe, it would have been accomplished in 24 hours. I also recognize the challenge of communication, the language barrier. So it is important that we commend the effort of Dr. Prosper and his team, given these challenges, which are very immediate. The forum meant the aim was to enable the pharmaceutical profession to have greater impact on improving and the efficiency of healthcare pharmaceutical services, to also organize professional and educational programs to promote good pharmacy practice and strengthen pharmacy force. I agree certainly with Dr. Mafo that leveraging technology is very important and crucial to the advancement of pharmacy practice. In the words of our own Julia Delucy Adeluyi, if you are an analog person in a digital world, you'll be left behind by the train of development. I think that we've done well. It is said that there cannot be success without a successor. Some of us who started the Africa Forum, who toiled, and you know, on a nostalgic note, you begin to remember the efforts of past president of the FIP, Dr. Jean Parot, Professor Kamil Mida, Didier Molum, NEA Mohammed, Sir Anthony Aime, and then our pioneer president, Mabel Turongo. These are pioneer people who worked tirelessly to ensure that this forum join the other forums and become impactful. So I like to recognize these names who have worked so hard. There's also Joyce from Zimbabwe and many other names really that work tirelessly to ensure that we are also with the other groups. It is a thing of joy to be here discussing pharmacy and how pharmacy can impact healthcare. I think that we've done so well. 70 years is like yesterday, but again, we have so much in front of us to be able to say we are here. I'm sure if we were a child, next year we should be voting in many countries. So we should be 18 years and the opportunity to vote, adult suffrage. So we have no more time to waste. We must. I am particularly touched by the speech of Dr. Mafo from Ghana. And I think that we must quickly articulate a way to ensure that whatever suggestions came from that beautiful speech is translated into what we can use to enhance pharmacy practice. I'm very happy to be here watching and enjoying what has been happening. And I like to say to everybody who is here, it's been a beautiful day for me. And I hope that next year will even be better for all of us in Africa and across the world. Thank you very much.
Your video. Thank you very much, Mrs. Okwa. He didn't want to, I think. Okay. Okay. Just a few minutes so that you can be captured. And we thank you very much for the goodwill message. Former President APF, Pharmacist Azubike Okwo, FPSN.
Thank you.
Yes, sir. I will now be calling on Pharmacist Jocelyn Chaiva, Vice President APF, and Chairman Retail Pharmacy Association of Zimbabwe for her goodwill message. 5 minutes, please.
Is my video on? All right. Thank you. Hello. All protocol observed. I thank you all for coming to attend this workshop. But first and foremost, I would like to appreciate Dr. Arinola, the president of APF as well, Dr. Prosper, for facilitating this meeting. It is very important for us as African pharmacists to actually work together for the development of our nation and for the promotion of pharmacy in our countries. We have worked together as African pharmacists under FIP, as APF, and you have UniTwin. And based on the presentation which have come, this is a very brilliant idea, so that we have a pharmacist wherever you are a pharmacist. And this is in line with the one FIP concept, whereby all pharmacists are pharmacists irrespective of country of training, and they can practice anywhere. And the quality of service provided is the same. I would like to appreciate all the presenters who have done a brilliant job to try and motivate all of us to be part and parcel of our noble profession of pharmacy. I would also like to invite all those members from the different countries to participate fully as associations. I've seen there are some presidents from other countries there, and we want commitment and participation from all of us. We are Africa, and we want pharmacy in Africa to be something, a force to reckon with. Of course, with the COVID pandemic, we've not been able to meet physically, but it's wonderful when you've got technology, which has made it possible for us to meet and share and learn from one another. And I also would like to appreciate the presentation, which is very pertinent on what is happening right now in terms of technology and vaccination. We're going to have a presentation on vaccination. And most of us, because of the legislation in our countries, we don't even know what to do. And yet we are in the front line, we're exposed. So I do appeal to all of us to do our part, to continue making pharmacy great. If I'm to quote former president of America, Donald Trump, let's make pharmacy great and keep it great. So education, pharmacy education is very important. Practice itself, let's keep up high standards. We are on the front line, let's keep going. Thank you, everybody. Thank you for listening. God bless you.
Thank you very much. I'm now going to call on Zita for her goodwill message. Zita, you're on, ma. Zita, you're on.
Okay. Hello, good afternoon again.
Good afternoon.
I don't know if
you're welcome. We can hear you, ma.
You can hear me.
Can we see you?
I started video. You need to see me? Okay, wait a minute. Wow, it refused getting onto the technology.
Just go ahead, ma. Just go ahead. Don't worry. Oh, there you go.
Okay, that's me. That's me. Okay. Hello. First of all, good afternoon again, and all protocols observed, because there are so many of you. If I start to mention it, time is not on our side. So I feel very much honored to participate again virtually in this important forum. It's very dear to me, pharmacy profession. I am a pharmacist myself, and I'm a missionary pharmacist. So I'm greeting you from Arusha, Tanzania. My area of concern is after the problem of 2020, I have seen that Africans have risen. They rose to the occasion to strive to protect themselves. And African pharmacists, I think they did a good job so far, considering the limit, let's say resource limited setting we find ourselves. First, I would like to just go straight to what, not to waste time. I love the presentation. They're very rich, very informative and educative. There is an area I would like us to add to our cart or our basket when we go shopping. That is, I think Professor Osifo was really hammering on it. We need is academic pharmacy, but we need to strengthen human capacity in pharmaceutical manufacturing and regulatory oversight in Africa. And this is the area I am concerned. I have been dealing with it for nearly 20 years in Tanzania. And so I just like to give this message as my own goodwill message, thanking all of you for organizing this. The name of the program we run is BIRDS, Biotechnology, Innovation, Regulatory Science. And we do it in collaboration with Purdue University. It is possible to collaborate and work with international world-class universities. And so many of our Africans have benefited from this, and we need to tap and come on board and embrace it. About few of you sitting in this hall program, and some have really participated. Some countries have participated. The little paper I sent, I'm sure you will put it in your program procedures so that others will read it. It is a graduate level education where people who have first degree in pharmacy or chemistry, they come together. They're all working class people. They have first degree or second. But because of the way African medicine is handled, we make medicine, okay, we manufacture, but some of them are not up to international standard. And the regulation oversight is very weak. And so there was a program that came to my mind because I have traveled a lot as missionary pharmacist, US, UK, Africans, and Nigeria I have worked. But when you come to overseas, the quality of medication we see and what we see in Africa, there is a little bit of difference. The laws are there, but they're not enforced in Africa. But how do we do it? If people are not taught and helped, and so this program came on board. That's the way it is. It's called BIRDS. If you need more information, you will contact us or those who have done it. I came to realize that there are very few universities in Africa offering this high level or specialized education. And that's why Professor Sifo's topic is very apt. I think he knows what I'm talking about. He's been there. It can be fleshed out. It has increased. The technology has emerged and it was a good success. We had 200 students registering last year. Pandemic did not disrupt us. We did all our interview online, Zoom, and we selected them. Our Africans were struggling with internet connectivity, but many of them managed to persevere. Lectures were held, group interaction was done, and this was happening in Tanzania, Africa. So there are so many good things happening in Africa. And that's what I want to say. We are doing a lot and we could do more. And the academic pharmacists need to come together. Professional pharmacists need to come together and embrace it. It is, I cannot read everything. Let's stop the talk. Let's walk the talk. It's a call to action. What is done, let's do more to improve what we have. This is the model of our program. You know, academia is where we get education. Then the industry and regulatory bodies and their peers, everyone is in the same classroom, learning, finding out the problem. And so this is how it goes.
We will hello, ma. Hello, ma. We will get back to you.
This is my last slide anyway. This is my last talk. I would like to say that our alumni who are Africans, they are coming from Nigeria, NAFDAC, industry, MZO. They're coming from Tanzania, Kenya, and Uganda. So the list is there. Please, academic pharmacy, continue what you try to do. We need the association and we need the collaboration. Thank you. For those who organize this, may God bless you and let it not stop at the conference level. Thank you very much.
Thank you so very much. Thank you very much for that message. Finally, I'm going to call on Dr. Awite of Ghana, PSGH, to give the final goodwill message before we call on the sub-theme speaker 2. Dr. Awite, are you there?
I am.
You have 5 minutes.
Good.
Please.
Oh, it is just to say a very good afternoon to everyone. I'm at home. I would have loved to be there in person, as you know, but I'm supporting and supporting the ESCO and the APF in general. We'll continue to do that as the Pharmaceutical Society of Ghana. So just to wish everyone participating a very successful conference. We'll continue to coordinate the formation of the Association of Faculties of Pharmacists from the Ghana country representation, and they will make sure it is done and properly done. Thank you all for tuning in. God bless you all.
Thank you very much. I appreciate you for that. So now we're going on to the sub-theme 2, which is a very interesting topic for many of us on vaccination. And I believe Pharmacist Jackie Mamin is online. I will just quickly read her a citation. Ms. Jacqueline Ann Mamin is currently the Chief Executive Officer of the Independent Community Pharmacists Association, ICPA, of South Africa. She graduated with a B.Pharm distinction from Rhodes University in 1985. She has been an active community pharmacist for the past 35 years. Other qualifications she holds include Management Program for Non-Profit Organizations distinction in 2014 and University of Stellenbosch Business School course in Accounting and Finance for Medical and Health-Related Professionals distinction, Center for Accounting Studies, UNISA, 2000. She has served on various committees at the Pharmaceutical Society of South Africa, PSSA, and was the founding director of the Independent Community Pharmacy Association. She is serving her second term as an elected member of the South African Pharmacy Council, where she is the chairperson of Practice Committee. She is the CEO of ICPA and past chairman of the Cape Western Province branch of PSSA. Please join me as we welcome Pharmacist Mamin to give her something.
You're welcome, Ma. Thank you very much, Dr. Joda, and I'm hoping that you can see my screen. Are you able to see my screen? Right, I'm going to go ahead. Thank you very much for this invitation to speak here this afternoon. I am deeply honored to be amongst so many eminent persons and colleagues. So thank you from a sunny South Africa. Right, my topic today is on vaccination through pharmacy. What I'd like to do is just give you a brief overview of who ICPA is. So we are a non-profit company of about 1,200 independently owned pharmacies. We represent 3,500 pharmacists and about 20,000 support personnel. As I say, my topic today, I'm going to be looking at 4 different areas. So firstly, pharmacy during a pandemic. I'm going to briefly touch on some of the technological innovations that have happened during the pandemic, vaccination through pharmacy, and then just to end off, chat a bit about the establishment of an African association. So dispensing during a pandemic. So COVID-19 obviously has been a major threat to healthcare systems and to human life right across the globe. But it has also created an opportunity to re-evaluate our healthcare environment, to fast-track regulatory challenges that may have otherwise been slow to implement, and it has thrown up resources within our communities that were previously overlooked for the more traditional methods. The digital space is an area, especially in South Africa and across Africa, that was slow to be utilized, but COVID-19 has allowed for quick regulatory review to allow things like virtual consultations as both healthcare professional and patient attempted to choose safety over face-to-face consultations. While the lockdown in most countries saw the closure of many healthcare environments, pharmacies remained open even during hard lockdown, and we became the location of choice for community members needing to access healthcare. Midnight on Thursday, the 26th of March last year, South Africa went into full national lockdown following some confirmed cases of COVID-19 in Gauteng and KwaZulu-Natal. Only essential services remained open during this hard lockdown, which included grocery stores, banks, and pharmacies. Throughout the pandemic, pharmacies put their patients first and remained open when everyone else stayed at home. This was a challenge because according to the Occupational Health and Safety Act, we as employers are compelled to keep our employees safe in a safe work environment. And obviously this was a challenge in the middle of a pandemic. But pharmacy and pharmacists are innovative. The first thing we did was we put perspex screens up between dispensers, cashiers, and customers and patients. We instituted health screening and temperature monitoring at the entrance of our pharmacies, together with hand sanitizing. Paperless scripting was promoted. Cashless sales transactions such as SnapScan, tap and go payments. Medicines were delivered from electronic orders to vulnerable patients who didn't want to come into areas where there were other people. Medical reps could no longer come and detail face to face, and so they started detailing us via Zoom. And of course, we had to quarantine stock from wholesalers. And when medicines were delivered to old age homes, the medicines were put into quarantine for 24 hours just to ensure safety. As an essential service and one of the few retailers open, pharmacy was an absolutely critical service during hard lockdown. We gave advice and reassurance to a panicked public. We gave education on infection control protocols. We had delivered OTC and acute medicines to the vulnerable, and we extended prescription refills for chronic patients. During hard lockdown, a lot of doctors' practices were closed, and our regulatory body, South African Pharmacy Council, together with our medicines regulatory body, allowed for prescriptions validity to be extended to 12 months. In South Africa, normally scripts may only be repeated for 6 months. And this helped a lot in making sure that our chronic patients still got their medicines. We had a bumper year of flu vaccinations last year and this year, as people were concerned that if they had flu on top of COVID, there could be really drastic and dire consequences. And of course, as pharmacists, we supplied symptomatic treatment for mild COVID-19 people when the hospitals were too full for these people to go into hospital. And we were able to monitor things like oxygen saturations and for people who were on oxygen at home. Lockdown fast-tracked many technological innovations in pharmacy, and Dr. Marfo touched on so many of these, from electronic scripting to e-pharmacy and online pharmacies, social media platforms. Telemedicine became really prevalent in our country to the point where our medical schemes in the private sector pay for telemedicine consultations. WhatsApp was invaluable. We set up WhatsApp groups for our colleagues where we could warn each other about pharmacies that needed to close down because they had a COVID scare. We could share stock when there were stock shortages. And of course, we had patients WhatsApping us. Remote diagnostic monitoring for our patients who were vulnerable and at risk if they contracted COVID. We were able to monitor blood pressure, blood sugar, peak flows, oxygen saturations, and temperatures from home. So ICPA during the pandemic also introduced a number of innovative new services, from virtual consultations to a COVID-19 testing program to something called pharmacy safe spaces. And I'm going to very quickly touch on them. So Kamba Yashanga, which is Swahili for beautiful string of beads, was about virtual consultations with patients. It was a telemedicine platform that put pharmacists and asthmatic patients in contact with each other. It also allowed a pharmacist to contact a doctor. This meant that our asthmatics could stay at home. We could have a face-to-face virtual consultation with them, and then we could check in with their doctors to ensure that they had the correct medicines and that we kept them healthy during the pandemic. Our plan is to extend Kamba Yashanga to include diabetics next. we approached, after being asked by the regional departments of health, one of the big funders in South Africa called the Solidarity Fund, to offer COVID-19 testing for healthcare workers, both clinical and non-clinical, to help keep healthcare workers healthy and safe. We managed to get free tests, 36,000 of them worth around 28 million rand. And our pharmacies set up drive-through and walk-in COVID testing stations. The program was a huge success and a feather in the cap of pharmacy, helping our healthcare workers stay safe. Unfortunately, the darker side of lockdown, we here in South Africa saw a marked increase in gender-based violence. And once again, pharmacy responded with the Safe Spaces initiative. South African pharmacies were designated as safe places for victims of gender-based violence. It was a safe space where somebody could come in and speak to pharmacists. In collaboration with the Psychological Society of South Africa, we were able to offer these victims free psychological support from registered psychologists. So as pharmacists, we could offer referrals, first aid, medicines, and sometimes just somebody to talk to. Now to the one item that's everybody's interested in, and that is vaccinations through pharmacy. So when the first vaccines arrived in South Africa, there was great excitement. And pharmacists, as the custodians of medicine and experts in cold chain management, were central to the vaccine supply chain. We did a lot of lobbying and advocacy for pharmacy, and pharmacy in South Africa became pivotal in the administration of vaccines in this, probably the largest public-private partnership South Africa has ever seen. So as we know, the South African government is the sole purchaser of vaccines, and they distribute these vaccines to both public and private facilities. Currently, there are about 600 pharmacies offering vaccination services across all of our provinces. The reason we were so ideal was that many of our pharmacies already had nurse-led primary healthcare clinics, which is an ideal site from which to vaccinate as a multidisciplinary team. But in conjunction with that, South African Pharmacy Council said vaccinations are within the scope of practice of a pharmacist, so long as they deem themselves to be competent. And so, together with the universities, we underwent training and some clinical studies. And South African Pharmacy Council then, together with the National Department of the Health, issued these pharmacies with what we call a Section 22A15 permit, which basically expands the scope of practice of pharmacists and nurses, giving us access to scheduled vaccines, that's prescription-only vaccines, and to the medicines that are required in the emergency tray, such as adrenaline and cortisone. To date, Pharmacy Council has issued well over 1,000 Section 22A15 COVID-19 permits. Pharmacies can vaccinate. We have the infrastructure in place that means we can claim from medical schemes for insured patients, and we can claim from the National Department of Health for the uninsured patients. And obviously, pharmacists, we can assist with adverse events following immunization. In South Africa, we have a number of mass sites, and I'm going to show you in this next slide that mass sites, which are non-health establishments, in order to be able to offer vaccinations, had to be linked to a pharmacy. And we stood by our adage that if there are medicines involved, a pharmacist must be present. And that is held true here in South Africa. As we went into our vaccination protocols, the Department of Health put forward 3 national electronic registries. The first was a national registry of all health facilities in South Africa called the Master Facility List. The next was a centralized platform, which we call the Electronic Vaccine Data System, or the EVDS. And this tracks every single vaccination in South Africa linked to a unique identifier such as an ID or passport number. It also tracks every single vaccinator and links the vaccinator to a vaccination facility to ensure that only competent vaccinators are vaccinating. In parallel to this, a stock visibility system was built, and it was expanded for use in both public and the private sector. And this records all stock levels of vaccines, giving the National Department of Health a helicopter view of exactly where the vaccines are, what the usage is, if there's any wastage, and allows them a view of any potential wastage due to expiry, because you can see the expiry dates as well. The SVS allows the National Department of Health to plan orders and distribution according to usage, need, and stock levels on hand. The EVDS, or Electronic Vaccine Data System, is quite an amazing platform. We allow self-registration of eligible people. Currently, we are vaccinating anybody over the age of 35. So you go onto a mobile app and you self-register if you wish to be vaccinated. The EVDS then allocates this vaccinee to the closest vaccination site, usually within 5 to 10 kilometers, that has capacity. It sends a vaccine code to the vaccinee and the booking time and slot. It allows vaccination sites to set up these booking slots and allows the vaccinators to view the allocated and booked individuals. And it also has the technology to be able to send an SMS to remind them of their vaccination. Once the vaccinee comes in, it confirms the ID and records the medical history, the informed consent, the vaccine type, vaccination date, whether it's the first or second dose, if it's a 2-dose vaccine, or single dose, if, for instance, it's the Johnson & Johnson. And lastly, it records any adverse events following immunization. It sends a booking if there is a second dose, so it reminds you 3 times when your second dose is coming up. And once that is done, it sends a vaccination SMS confirming vaccination, almost like a vaccination or vaccine passport. So in the United States of America, the vaccine rollout began with mass sites, and it really didn't take off. And it was only once they involved community pharmacy that the vaccine rollout really started to gain impotence. In South Africa, pharmacies are the main contributors to the vaccine program. And some of these reasons we already know. People trust pharmacists, people prefer personal service, and people prefer not to queue at mass sites during a pandemic. So there are many reasons to choose pharmacy. Here is a dashboard of our vaccines. So as of the 28th of July, in South Africa, we have administered 7,065,432 vaccines. That is broken down into Pfizer, which is a 2-dose regimen, and Johnson & Johnson, which is a single dose. And we have a view of this dashboard from our EVDS, which we can look at every day to see exactly where we are. Our plan is to achieve population or herd immunity to vaccinate 40 million people. So we've got a way to go still, but we're well on the way. And one of our serious constraints that has been recently is the lack of vaccines. We have been in a very vaccine scarce supply chain, but we're very pleased to hear from our Minister of Health that a large COVAX installment of vaccines is arriving this next week. And for the first time, vaccine constraint will not be what is holding us back as we move in and open up to the over 18s as of the 1st of September. Here's just some photos of vaccinations that have been happening in South Africa across our pharmacy clinics. So in the bottom right, you can see some of the queues with social distancing as people wait to go into a community pharmacy. And there you can see one of our nurses, or many of our nurses, giving vaccinations. It has been a most rewarding experience. Every single pharmacy that has gone live talks about the sense of hope, the gratefulness of the people coming in to be vaccinated, and the lifting of spirits of the pharmacy staff. Obviously, the first thing we did was vaccinate all of our pharmacy staff just to keep us safe as these thousands of people stream through our pharmacies. Currently, we are vaccinating at about 220 to 250,000 vaccinations a day, so about 1 million people in every 4 days. And our minister has asked us, now that more vaccines are arriving, to ramp this up to 1 million every 3 days, so to 330,000 vaccines. And our pharmacists are ready for this. As I end off, I'd like to just touch a little bit on the establishing of an African association. And I know that the previous speaker was talking about an African association of the faculties of pharmacy. And we all know that none of us would be here without education. I'd like to take it a step further and say, imagine a world where we had an African association, not just at university level, but an African association of pharmacy, of medicine. The benefits would be so many. We could collaborate across Africa. We could replicate pharmacy successes from country to country. We could allow the movement of pharmacists and pharmacy support personnel to practice in different countries in Africa without having to sit professional exams. We could prevent duplication of efforts. Imagine if a medicine that was registered in Ghana through their regulatory bodies could then automatically be registered in all the other countries in Africa, instead of going through the regulatory bodies of each individual country. Imagine how our medicine supply chain could improve if medicines could freely flow between the different countries without so much regulatory red tape. Of course, there will be some challenges. I think Prof. Yusufa spoke about these, and that's the language and cultural differences. But you know what? That's also what makes Africa so rich. Obviously, there are regulatory differences across Africa. We'd need to be aware of those. I really do believe that alignment of education, especially with regards to pharmacy support personnel, would be hugely beneficial to this continent. And one of the other challenges could be ensuring equitable distribution of human and medicine resources, in that the biggest, richest countries maybe would hold on to medicines, and we would need to guard against that. So what I'm going to say now is, where do we start? Well, we all know the adage about how do you eat an elephant? One bite at a time. So as Dr. Martin Luther King said, you don't have to see the whole staircase. Just take the first step. And Africa, I truly believe we are stronger together. Thank you.
Wow. I heard that, am I the only one that heard that over 7 million vaccines have been given in South Africa? Oh, wow. Oh, wow. And they're targeting 40 million people. Oh, wow. My mind.
Thank you, moderator. Thank you, my dear colleagues. Thank you, moderator. Very exciting paper on vaccination through pharmacy. Lady Jackie, pharmacists, by all definition from the resume, that they leverage on formation of an independent committee pharmacy association in South Africa, a non-governmental organization, so say. That, but they were faced with a lot of challenges, particularly during the COVID-19 era, which is still on. And it brought a lot of challenges that they needed to exploit the digital space and utilize it, as it were. He stressed so much that hitherto, we were all reluctant to occupy the digital space in doing our work until the emergence of COVID-19 that had to provoke all of us, as it were, particularly in South Africa, to embrace the digital space in doing their work. He shared the example of South Africa during the lockdown, where pharmacists were available to carry out their duties by innovating when other healthcare workers were not available, particularly the hospitals were shut down. He talked about what they were doing then. They were carrying out health screening and cashless sales, which we talked about, that while you carry this out, you also need to get reimbursed, but they also develop maybe some of the packages to look at cashless sales. Electronic orders were obtained, particularly for vulnerable patients, as he said, and detailers, medical reps, would no longer go down, but they were utilizing the Zoom, which today had become one of the new normal. Pharmacists offered critical services, he said, advise patients online, particularly those that were afflicted, and prescriptions were obtained, and they also got a leverage from their government to extend the lifespan of his prescription. That's very important. We're not doing that here. Sometimes they come around with controlled drugs in our own setting in Nigeria, and we begin to say, oh, this prescription is too old. But they got the authority of their government to extend the lifespan of the prescriptions, particularly for the critically those who refill their prescription. And monitor their oxygen uptake. That was wonderful. Created WhatsApp for remote diagnostic patients. They were also able to address it. But what interested us most is that there was the issue of virtual consultation by telemedicine, where the doctor can be consulted on a particular platform created by pharmacists, and the patient will get help. Because there were some testing COVID-19 stations that were created. He talked about those that were created and approved by government. He talked about the safe space developed by them, and they got psychologists to come into it, because it was not just the pharmacist alone to be able to counsel patients, but they needed psychology to tell the patient that having COVID-19 was not just a death sentence, but a way that has been challenged and there are solutions for it. Now she narrowed down to vaccination itself through pharmacists. And our pharmacists are custodians of medicines. And as such, they are very competent in keeping the cold chain. They know how to keep and maintain the cold chain. Because without the cold chain, there's no success of a vaccination anyway. He talked about over 600 pharmacists have been licensed offering these vaccination services in South Africa. And the South Africa Council has been able to innovate by recognizing and approving some of these things for them in collaboration with the healthcare structure that they have to be able to expand the scope of pharmacists and grant them permit to vaccinate and make claims for services rendered. That's to be underlined. Not just free, but also make claims for services they have rendered. He talked about the site typology, especially site mandatory for pharmacists to be able to be present, and carry out national electronic register was then created to be able to capture electronic vaccine, to track every vaccine that available, track those who have taken it, track the wastage that may be involved, etc. He talked about electronic vaccine also, data system, that allow all registration of all eligible persons to be vaccinated, generate ID, generate data, and medical history, etc., and recognize adverse effects. This, I think, is very, very necessary and important. He cited the example of US, and what they were doing was more than what the US did. Their involvement in South Africa was much more better than what pharmacists were allowed to do in the US. And of course, he talked about the COVID-19 dashboard, that so far, they've been able to vaccinate 7 million people, but their target is to reach 40 million population. That's very impressive and very encouraging. She talked about the constraints that they faced in carrying out these duties. Number one is the issue of lack of vaccines that are inadequate for their country. And in doing this, the vaccination in pharmacy clinics were designated, of course, and they have been able to vaccinate about 220 on a daily basis. They carry out 220,000 vaccinations on a daily basis. And that in 4 days, they're able to reach about 1 million. He talked about establishing an African association that can advocate for this, in essence, that there is need to have this formation. And I think APF is already filling that gap. But what she might be talking about is to look at a coordinated body that has to focus on vaccine, because all of us might not be doing vaccination, all pharmacists. So it might be recommended, I suggest, and I think, that those in community pharmacy and those that are available need to be registered and form a strong association to be able to reach even the very remote regions where the people need our services. And it talked about APF must have a common regulatory body to reduce bureaucracy. And I think this is doable if the registrar is here and other registrars in those countries that have regulation, to be able to have an equitable regulation that will reduce bureaucracy, as I said. Number 2 constraint, according to her, is that equitable distribution of medicine is being an issue. And then there is also need to be able to reach out to every person and ensure that these things are available and as when due. I think these by and large are the points I was able to pick from her paper, and that it's a big challenge for those of us who have not started, and I hope we can share more of the experiences of South Africa in vaccination through pharmacy and get it done. And I'm happy the registrar is here, and what he's doing could be influenced by what we have had today. I wish all of us success in this endeavor. Thank you.
Thank you very much, Chairman. So I think our minds have been blown by the various lectures we have heard today. We have gotten full dose from the keynotes, the sub-theme 1, as well as the sub-theme 2. So we're on general discussion, general question and answer session as a time for us to actually come together to look at some of these things. I would start off the discussion on setting up an African Association of Faculties of Pharmacy or Schools of Pharmacy or Colleges of Pharmacy. As Professor Sipo said, it's not as if the name is cast in gold yet. It will take a committee of deans of various faculties to agree on what they want to call it. It's not our decision to make on their behalf. But APF is offering that steering position, that steering seat for the establishment of this association. We are offering to serve as the secretariat for now, while the association gets on board, so that at least there is a center for coalition and what's the word now? Coordination of activities while that association gets its feet up off the ground. I will be serving as a desk officer for that association for now, while the association gets its feet. While we had sent out some, APF, we had sent out some information to presidents of national pharmaceutical associations or registrars of pharmaceutical councils across the region to provide us with the contacts of the deans or the heads of pharmacy of the faculties of pharmacy or the schools of pharmacy, as the case may be, in various African countries. We have gotten very few responses. So we're hoping that by this conference, more countries would have been sensitized. We'll be reaching out to as many people that have been on this call. We'll have the video recording of this workshop. So we'll be reaching out to anybody that is from any country that is on this call. Will be reached out to help provide relevant information for their country, to help us populate the database for that African Association to take off. We are, okay, just a minute, sir. You know, so that's what we're trying to do, so that we will use the APF as the springboard for the association to actually kickstart. Of course, if we had tried to do it before now, the association would have been populated with only Nigerian faculties of pharmacy, because I know how I can get all the contact details for faculties of pharmacy in Nigeria. By the time I sit on Pharmacists Council for 1 or 2 weeks, I will get all the information that I need. But we need more, as many countries across the region. The chairman of the day mentioned something after Professor Osipo's lecture, that there must be balance. If we say we should start with what we have, and we have Nigeria everywhere, that will even discourage other people from participating, because they will think that there's a hidden agenda somewhere, and there is none. But because we don't have access to many of the other countries, or they are not forthcoming with information, even the ones that we have not been able to get a critical mass of countries being represented, of faculties of pharmacy across the continent being represented. So as I said, we'll be reaching out to as many people as we can to get the information that we need to be able to effectively kick off this association. Okay, so that's the information I have to share about the Association of Faculties of Pharmacy. As I said, we're in discussion session, question and answer, and as well as any comments that we want to share. Going to the keynote speech by Dr. Mafo, he gave us a very concise message on technological innovations for pharmacy in Africa amidst the COVID pandemic. And of course, everybody is afraid of the Delta variant and the third wave right now. But that is where the world is. We are thankful to God that Africa has not been hit as we were expected to be hit. Discussions, comments around this topic. Do I have any hands up on the virtual platform? Or am I talking to myself? Because they say if you are talking and nobody is hearing you, it's either you are talking you have completely answered everybody's question, or you are talking a whole lot of bull.
Yeah, let me say this as chairman of this session. We've gone through the papers, and we are the participants here. We know a number of our colleagues are there online. But I think it's important that we take them one after the other. There's a big challenge coming up from each of the papers. And that's the area I thought we should reflect. Technology, yes, is here with us. We can't do without it, that's true. But there are constraints. There are limitations. And I thought we should look at those areas, learn from some other countries, maybe online. What have they started? We've had the prototype of Ghana. They couldn't have done it all. We started in Nigeria, but it's still not okay. So are there things we need to bring out from there so that at the end of the day, before we leave here, we have something to hand over to the community table to say, look, utilize this material so that it becomes a benchmark for various countries. And do not forget, at the end of the day, we're going to use this to advocate through the FIP to various countries. FIP in their preamble today did say that they will assist us to reach our various governments, depending on the outcome of this workshop. So I think that should also be a very encouraging we need to underline why this session is on. So what am I saying? We need to generate thoughts, more thoughts, in addition to what the lecturers have told us. I think that's where we are. So we're taking the first topic, the topic on technological innovations for pharmacy in Africa. Then when we finish that, we'll move to education and, of course, end up with vaccination, which involve a lot of technicalities, legislation, etc., which, if we have to start in some countries, we know that it will take many years. But we congratulate South Africa that they got the permit of their government within a very short period. I do not think that might be so easy in other countries like Nigeria, etc. But I do not need to also preempt that. Perhaps through this discussion, we can be able to bring that out. Thank you.
Thank you. So, can I share the screen? Can I share this lecture again as maybe a possible reminder? So we have technological innovations in Africa, in pharmacy, amidst COVID-19. Comments, contributions? Yes, Lee. Microphone.
Thank you. All protocols observed. My name is pharmacist Loye Akomalafe. I want to thank the chairman for his comments. It's what has inspired me to get up and speak now, is because as we've talked about the technological innovations in pharmacy amidst the COVID pandemic, I think there are some key factors that underpin being able to achieve it in the professional realm. It starts from the education. The reality is undergrad pharmacists are not necessarily getting exposed to technology as we speak. The pandemic has immediately caused everybody, as has been discussed today, to embrace technology via Zoom and many other platforms. But I believe in aspects like dispensing, patient medical record, electronic prescribing, things like that need to be included in the undergrad lectures and practice so that collaboration can actually start in the university. No reason why doctors, medical doctors, or the medical students can't send electronic prescriptions as medical students to pharmacy students and have case studies that they are working on as undergrads in medical school. The South African case study, the South African vaccination going on, said it got implemented in pharmacies that have nurses already there. Those are the type of things that the relationships that need to be built right from the university, where pharmacy students, nurse students, medical students, everybody needs to start collaborating right from that foundation. And that's my contribution. Thank you.
Thank you very much, Loye Komalafe. MD Tips Limited, which is a technological telehealth company here in Nigeria. So we're having a few people starting to delve into that area from within us. Yes? Any other contribution?
Let me just add to what you just said, which is quite interesting. I remember we visited the intensive care unit of a university in Atlanta, Georgia. And we were not restricted, myself as dean and the head of clinical pharmacy, Professor Nato. We went in, and there was something the medical doctor, the consultant said. He said, look, without pharmacists, we'll be in trouble here. That gladdened my heart. And there was no restriction. The pharmacists provided the necessary advice to enable them reach conclusion on whatever they were doing. And so there was something our chairman said, documentation. Pharmacists need to document whatever, even if they don't allow you to start, document what you have. When you have evidence-based activities, you can present it at the right time. There was a young pharmacist that finished from my university, did his internship at the military hospital in Yaba. And this medication errors from past records for about 6 months during his training. The madam supported. And by the time they analyzed and they had very good evidence, they went to the commanding officer, who is a medical doctor, presented their work. And when he looked at everything, He insisted, you know, the military one, the pharmacist must be on ward anytime there's ward round. But without those evidence-based information, you can't get anywhere. That's why one thing I have in my office, in God we trust, the rest you must show me data. All my postgraduate students, yes, we trust God together, but when it comes to research, I need to see the data. So I think that's one of the things we should, even in the hospital, I am confident you could start something in whatever ward you are doing. I remember going to the psychiatric during clinical meetings, and the MD said, but you're in pharmaceutical chemistry. I said, but I'm a pharmacist. And so, because some of the questions I asked were a little bit, it was jittery. And lastly, I would just say, I visited Bayelsa, and a young internee, though he finally passed on, had cancer. And we worked there with the director and said, look, we needed to see the consultant who was managing him. About 16 pharmacists sat down, also sat down. She came in, when she saw pharmacists, she was a little bit jittery. She said, relax, madam, we just want to ask questions, we are pharmacists. So she was careful what she was answering, but we worked together to improve the care, to know what to do and what not to do. And I think when these things keep on going, without antagonizing somebody, but you know what you are doing, it can only be better for us. Thank you very much.
Thank you very much.
So just some comments. First, I want to congratulate the leadership of the African Pharmacists Forum. I must confess I haven't been very active in the forum. And to think that all the founding fathers of the forum are still around
Exactly.
speaks to the fact that we're indeed a very, very young forum indeed. But we are coming in at a very good time. The FIP is pursuing a concept of one FIP, in which case all our programs, all our projects will be done under the umbrella of FIP, and all of them they plan to implement through the regional forum. So the African Pharmaceutical Forum is coming up at a good time. I want to speak a bit to the role that the industrial pharmacy section will play. The sections, the practice sections now will have global blueprint and support the projects of the regional forums. So whatever it is that we come up with, whichever affects the industry, I'll say that we're ready to support and go through with implementation of all the projects. And one thing I've come to realize, you know, having served for just a little period in the leadership of the industrial pharmacy section, is that Africa is peculiar, okay? We were just 16% of all population, but we have 30% of all the languages in the world.
Wow.
Africa's genomic diversity is the highest in the world. And in this season of biotechnology, of genomics, of personalized medicine, we need to find solutions to our own problems ourselves. Our infrastructure deficit is probably the highest in the world. Resource limitations, probably the worst in the world. But the beauty of it is that technology is available for us. And in its generic state, we can manipulate it to solve our problems. So the challenge is on us to develop solutions that will address Africa's problems. And the beauty of it is that the FIP keeps saying, come up with your projects, come up with your solutions, we will help you, okay? And let us tap into that resource. It's available for all of us to exploit. Thank you very much.
Thank you very much. Thank you very much. It's gladdening to hear that. Yes, please, the microphone.
Thank you, the organizers, all the speakers. My name is Biere Habatsin. I work with the Nigerian Institute of Medical Research. You know, talking about e-commerce and using technology, you know, I was thinking and I just felt I should share this, that the chaotic supply chain system and drug distribution system in Nigeria, you know, we could actually take care of it if we embrace technology. We can remove the non-pharmacists from the system. I will give an example. Many years ago, over a decade now, I was in South Africa for a course, and we went to this supply chain system, for drugs, and everything, was electronic, right from order, sorting out the distribution. Everything was remotely done, but they had this huge warehouse, and wherever your pharmacy was, just place your order through phone or the internet, you will get your drug at your pharmacy. I think we as pharmacists should begin to think of this, because we are more knowledgeable, and we have the contacts, we can contact ourselves. If we begin to adopt things like this, before you know it, the Onitsha market, the Kanu market will close up, because no pharmacist will patronize them, and we would patronize ourselves. Thank you.
Thank you very much. Okay. Please, can you move the microphone in that direction? I can't see any hands up on the virtual platform. And it's gratifying to note that we still have over 80 people online.
So, good afternoon all. My name is Pharmacist Adeosun Shakirat, and I'm the Director of Pharmaceutical Services at the Lagos State Primary Health Care Board. Permit me to stand on existing protocols. And mine is by way of comments. One, it has been a very, very enlightening workshop, and I'm glad to be here. The topic, or the topics that have been covered, are very, very apt and timely. But I'd like to share the experience on the public sector when it relates, or as it relates to technology. We've heard or listened to so many types of innovations, but in the public space, one app that we have used, and I believe strongly that we may want to key into in the private sector, is the use of the Open Data Kit, ODK. This app is something that can be used on the Android phones. You can capture your data without going online at that time, and then afterwards, you can upload. The data can be used to also capture service and logistics data. You can capture the geo-coordinates to be sure that this facility or this person is the one that actually used or carried out the particular tasks. And that's one thing that we've used greatly in the public sectors. So many programs have used it, especially immunization. However, for me, I don't see the pharmacy space keying into that. And I think that is a big, big gap. I think it's something that we should key into. Again, when you are looking at, when Mr. Chairman Sahime was talking about those in the hard-to-reach areas and the remote areas, I want to believe strongly that, going by what the PCN registrar had said, if by chance we have the policy documents in place, the online or the virtual pharmacy will be a good thing to do. Because for me, we do not even have the requisite numbers of pharmacists that can reach everywhere. Are we talking of places like Badagry? We are talking of places like Epe. We are talking of places like Ikorodu. The patient... Oh, that is Lagos. So, and most of these people are, most of the pharmacists are domiciled in Lagos. How many do we have everywhere? So for me, I think we should, as a body of professionals, still look at our numbers and see how we can deploy these numbers to service other areas. So far, we can use technology. We know that, okay, this person is in this particular zone. Maybe this pharmacist is in Ojodu. So using your innovative app, how can I service and see what is happening? Have a bird's eye view. with our regulatory body and our task force. I think that is very, very important. And I look forward to that time when PCN will have the requisite policy documents in place, especially to regulate vaccination and our online pharmacy practice. Thank you very much.
I have a hand up on the virtual platform. Abdi Karim, please go ahead.
Turkey in clinical pharmacy, but also I am a member of the executive committee of FIB academic section, which I think is a house for all. I can see many, I was very impressed to see many African academicians present in this platform, and I think the academic section also, when we are talking about one FIP, the academic section is the house for all academicians, regardless of their positions as deans or non-deans. And unfortunately, we have very weak representation as Africans there. We have only 20 members from 20 countries present there, while 34 countries, African countries, we don't have any members from them who are present there. So I would like first to invite all colleagues that are present in this call from different African countries, from different African institutions, to actively be present there in the academic pharmacy section of FIB, where there is where the section is really very much oriented to address our problems, capacity development in middle income countries, and educator development. And returning back to reflect on the topic today, it was really a very enlightening and very great workshop. I want to thank millions to the leadership of AAPF for and all the presenters and everyone who had contributed in or facilitated the holding of this workshop. It was it was one of my best Saturdays that I have for a long time, participating in this workshop. Very great presentations from Marfo and Chaki. And I think Marfo and Chaki both have presented or showed the case of pharmacists in Africa. A pharmacist, an empowered pharmacist in Africa is very crucial. An empowered pharmacist in Africa is the answer for the health challenges, the serious health challenges that Africa has. A pharmacist maybe in other countries or in other continents can provide a service that can improve the life of patients, of people. But in Africa, a pharmacist is capable of saving lives. An empowered pharmacist is capable of saving lives in Africa. And the answer and how to get this pharmacist is education. So it was very great to have all these topics with the foundation of the African schools of the foundation of the establishments of the African Schools of Pharmacy Association. Also a great idea. I strongly support this idea. I would strongly call the leadership to pay all the efforts to develop this platform. It's very crucial for us, all Africans. It's very crucial, and also I will strongly call to have an accrediting also surface in this association, so that all the curriculums, all the universities will have evidence and will have tools that they will guide them for the development of their curriculums in newly establishing schools. In a country that I came from, Somalia, for example, where there is we don't have regulations for medication, regulations on medications, quality assurance of medications. We don't have a proper curriculum that's unified for all the country. We don't have even proper practice settings or regulation on practice. The establishment of such platform will be very helpful for such regions in East Africa. And we always feel that we are not present or presented always in important places as ABF, as East Africans, mostly because of us, not because of the organization we have. So I'm really happy to be present today here with you. I'm really thankful for all of you, for the presenters and for the leadership, and thanks for giving me this time to deliver my message.
Abdi, you are from which country, please? He's an executive officer of the academic pharmacy section. Abdi, which country?
Yes, I'm currently in Yeditepe University in Turkey, working as a full-timer, but I'm also affiliated to Just University in Somalia, which is one of the new faculties that's establishing pharmacy education there. So I'm affiliated with also this university, but my full-time position is in Turkey now.
Thank you very much. Okay, we also have another hand up on the site. Adeyemi, please unmute yourself. There's a running mate for you on the virtual platform.
Okay, thank you very much, Arinola. My name is Sylvester Adeyemi, a young pharmacist, Abuja, Nigeria. And I very much agree with everything that has been said so far concerning having a unified pharmacy education in Africa and technological advancement in pharmacy practice. As one of the speakers mentioned, the best way to get across to pharmacists basically is through education. And the essence of the unified faculties of pharmacy across Africa is timely because technological advancement, we can't really bring that change to practice. We can't even practice digitalized health or e-pharmacy if undergraduate students do not have the prerequisite training or the prerequisite exposure to working in a technological space. I remember that during my internship time, there were a lot of, even as a pharmacist, but it was until I ventured into the development space that I got to know how to use ODK and other database devices and tools. So having that pre-service training in our curriculum for pharmacists, for student pharmacists to know how to manage situations in a technological space is very important. So I think that this is one of the points that could be reserved or that could be recorded for any deliberations in the future regarding technological advancement. Thank you.
Thank you very much. Dr. Samuel Adekola, virtually. Please go ahead.
Thank you very much. Well, I'm not able to complete because I'm actually body right now. But however, let me just say that I use the opportunity to bring a good way from
they've cut off his Wi-Fi. He was supposed to join us physically, but his flight was delayed till 3:30. He said that he's boarding. He was supposed to have come into Lagos this morning, but his flight was delayed till 3:30. From Akure? No. From Ondo or something. Okay. While, okay, so another hand is up. Monica Agu. Please go ahead.
Okay, good afternoon, everyone. I'm actually happy to be at this workshop. I want to talk from the industrial pharmacy training, education and training. And the point I want to make is concerning gaining the necessary skills and education to be able to manufacture medicines that are of international quality. I want to ride on the back of the goodwill message from Sister Zita. I have been part of the program, the BEST program, and that program is a sponsored program, and so many pharmacists and some other scientists in industry have participated and gained a lot of experience. And I want to draw our attention to the fact that pharmacy education doesn't end when you get your pharmacy degree. There has to be continuous education. And in pharmaceutical manufacturing, for you to be able to make medicines of international quality, you have to gain the knowledge and the skill and learn the science of making medicine. And that is what Reverend Sister Zita have done for Africa. She has seen that the organization that she worked for, they were getting medicines donations from outside. And she questioned, why is it that medicines from African manufacturers are not being supplied? And she was told that you people don't know how to make quality medicines. And that's how she sought to be able to support the pharmaceutical manufacturing industry. And she got the Purdue University, USA, to be able to collaborate with her to set up this program in Africa. And so many people in the industry have taken part in this program. And so many, during this COVID, it was even as if it's a plus, because it's now being done online. Many pharmacists and other scientists in the industry are part of this training. And I must say that African Forum should take the opportunity that COVID-19 has presented to Africa. India banned some products, both APIs and finished pharmaceutical products, at the peak of COVID, and the whole world cried out. And now the world is looking at Africa to rise up, because they have seen that the world has placed all their eggs in one basket, which is India and China, and are looking at developing Africa pharmaceutical manufacturing. And even African Union, some years back, have seen that there is a serious security risk relying on outside countries for our medicines needs. Because if you're a pharmacist and you don't have the drugs, and we can attest to that, those in community pharmacy will notice that since the COVID started, a lot of products keep going out of stock, because especially when India was high hit with COVID. And this is the opportunity that Africa needs to take up. Even African Union developed a business plan for supporting the pharmaceutical manufacturing industry in Africa to be able to develop, to make medicines of international quality. And now that the outside world is looking at Africa and want to support Africa to develop, I think African Forum should take this up. The industrial pharmacy arm of it should take this up and take this up. There are a lot of support that are waiting for Africans to take. But if we don't see this opportunity, we'll just fold our hands and watch. Reverend Sister Zita has brought Purdue University, and they have been getting sponsorship. All this while that this program is running is being sponsored. One of the key faculties in this program, Professor Ban of the university, had to sell his business to raise the initial fund to set up this project in Africa. And I think this is what African Forum should tap into. Reverend Sister Zita, she didn't really come out because of her calling. She wouldn't be so loud mentioning it. But I am an alumni and I'm still part of the program. And I'm saying that African Forum should partner with her. Let's see how Africa should develop the pharmaceutical manufacturing industry now. It may interest you to know that manufacturing in Africa started the same time as in India. But see where India is now. So there is need for us to do situational analysis and see what the barriers are for us and be able to come up with interventions that will remedy this situation, because now the world is looking at us to be able to be an alternative, second basket where they can put their medicine supplies. They're looking at us and are ready to support us. So even though this is not really explicit in this workshop, but I want to throw it up as food for thought so that we will start looking into it. Let's just go and look at that business plan that African Union prepared.
Comments. We have gotten your comments. You have communicated loud and clear. Thank you so very much, ma. And we will get back to you as an alumni and get back to Stazita to also give us documents that we can work with to see how we can collaborate with the program. Thank you so very much. I think we're rounding it off at that point. I don't know if there are any other pieces of information. Tosin wanted to say something? Okay, no? Yes, it's lunch ready. I think. Okay. So I think we are rounding up now. Lunch, I understand, is served. And Dr. Okafo, we're going downstairs for lunch. Are we going downstairs for lunch? Okay. Okay, we'll be going downstairs for lunch. But before that, she mentioned it. I know we have not finished, General Secretary. I will call you, don't worry. I will not just enter lunch without doing vote of thanks. Okay, so we are in announcements. I was putting up the African Pharmacists Journal. That is the official publication of the African Pharmaceutical Forum. My office doubles as Assistant General Secretary and the Editor-in-Chief of the forum. And we have, thank you very much. We have the 2021 edition of the journal up on our website, just like we have past editions of the journal there. Only 2020 does not feature because COVID blew us all away last year. And so there's no 2020 edition. Yeah. That's that. Also, please remember, as I mentioned at the beginning, www.africanpharmaforum.org. That's our website for information about this workshop, the video of this workshop, the presentation slides, and other information about the forum will be on the website. Permit me now to welcome, goes first, the chairman for his closing remarks before we take the vote of thanks.
The president of APF, PSM president, ably represented here, all other protocols duly observed. Let me say that I'm glad we're coming to the end of this program and that you have been very good listeners, and thanks for participating in this very unique workshop for the African Pharmaceutical Forum. Let me therefore congratulate once again the current president of APF with his team for putting this on board. And I hope, as I said earlier, that we will all benefit from this workshop at the end of the day. But I won't sit down without paying glowing tribute to past leaders of APF. I remember the Mebe Torongo, who started it all in Zimbabwe, her tiring efforts that started it. And at a point, as I said, where APF was more or less in the air. But I thank God today we are witnessing a stronger and better APF body. And before I said goodbye, Madam raised an issue, the current DPS, of the paucity of pharmaceutical manpower. For me, I'm not trying to be selfish, but you know, pharmacists may not be available everywhere, but we're supposed to be available everywhere. And so if we're going to start this program, we have to start from somewhere. We have to start like a pilot study to say, maybe Badagry, Akwo-Ojo, or Yaba, and then encourage those who have to go to far-reach or difficult-reach area that may have to go by boat, etc., by giving some incentives. And I know that PCN acknowledged in their paper today that they have done some mapping. And the essence of that mapping is to showcase who is where and where do you practice, so that when you apply for license, you are told, please relocate to another area where there's no enough pharmacy manpower. So I think that is being addressed. We should really not be afraid of that. But by and large, what I should be concerned, and you and I, are the issues of tampering with our legislation. The resistance we're going to face from that That's the area that I worry, which I think we need somebody like you who is advocating for us at the Ministry of Health. We need other leaders. We need our president here to reach FIP to say, can you write to various governments to say this is the way pharmacy should go? Show the example of South Africa, success story of South Africa and Ghana. Their intervention during COVID-19 pandemic, and which they are still doing, and the success recorded. Somebody just talked about they were giving vaccine to 7 million. Can we boast of that even in Nigeria? And that their target is to reach 40 million, coming from pharmaceutical manpower. So I think that we need to reflect, coming out of this seminar, that let's play down. Yes, we have, nobody has enough. Nurses don't have enough to the population, neither even doctors, but we all are deficient in one way or the other. But how can we start to make this program reach our people? And as I said, you are a policymaker, our registrar is here. Let's encourage those pharmacists that want to go to rural area to practice. In Ghana, when we paid a visit some years back to Ghana on a walking visit, I noticed that in Ghana, they encourage, if you go to the villages to work, your rent is almost free. You are giving a loan to buy a brand new car. And I don't know if that still have, I know. I'm talking about 8 years ago. We spent 1 week in Ghana, we stayed in Kolebu, went around everywhere, all health facilities. And we discovered that pharmacists are everywhere. And we say, how did you do this? So those who want to serve in rural, far-reach, difficult area, give them special incentives. And they will go there and perform. And ensure they are also monitored. So that at the end of the day, we don't create unnecessary vacuum. But I want to say before this audience that pharmacists are ready to carry out their job when they are challenged and given the free hand and, as it were, what I would call legislation to work within what they are trained to do. Thank you once again for coming for this workshop. Again, to congratulate everybody. My dear friend, Dr. Prosper, congratulations. God bless you.
Thank you very much, Chairman. I know we had said earlier that maybe we'll be reading a draft of the communique. Do we still have time to do that? Yes, we're definitely doing a group photograph. Dr. Okafor, please. Please just go to the recommendations. No visitations, no other. Just go straight to the recommendations. Yeah.
Good afternoon once more, everybody. And I want to stand on the existing protocol because of time. Please, I'm going to read only the recommendations, no introductions and no attendance because of time. The sub-themes presented at the one-day workshop by eminent resource persons were setting up an African Association of Faculties of Pharmacy, vaccination through pharmacy, why the main theme was the technological innovations for pharmacy in Africa amid the COVID-19 pandemic. The theme and sub-themes of the workshop were deliberated upon, and the following observations and recommendations were made. 1. Workshop noted that the COVID-19 pandemic has led to an increase in technological innovations, both in the upstream and downstream pharmaceutical sectors, and has offered a great opportunity for African countries to adopt resilient approaches in developing the local information technology-driven solutions to reach their clients. Workshop noted the absence of regulations for the control of internet pharmacy services in many African countries and called on all pharmacy regulatory agencies to intensify efforts in the development and approval of laws guiding the practice of internet-based pharmacy in the region in order to prevent abuse and misuse of medicines. Workshop observed the indiscriminate online advertisement and sale of both over-the-counter and prescription medicines and urged the regulatory authorities to step up the enforcement of the necessary laws on advertisement of medicines. Workshop admonished pharmacists to be more proactive and embrace the use of technological innovations to expand and improve their practices amid the challenges posed by COVID-19 pandemic. Workshop also noted the need for African pharmaceutical regulatory agencies and academic institutions to ensure training of pharmacy students and practitioners on the appropriate technology innovations. Workshop recognized that the strategic position of pharmacists in the community is all-embracing. Pharmacists are trusted by the public, pharmacists are known by the community, and their role in providing access in medicines and vaccines cannot be overemphasized. These roles include patient counseling, health education and promotion, particularly in curbing vaccine hesitancy, supply chain management, formulation of preparations, national use and supply of medicines, proper documentation. Therefore, the workshop called on all national governments in the African region to recognize community pharmacies as vaccine administration centers in order to increase vaccination coverage in Africa. Symposium noted the depth of resource capacity in the pharmaceutical manufacturing and regulatory sectors in the region, and encouraged the national government to put strategies in place to strengthen the human resource capacity in the pharmaceutical manufacturing and regulatory sectors in order to ensure availability of quality medicines. Symposium noted the challenges of multiple languages across the region and the reluctance of some pharmacy faculties to share knowledge, and therefore emphasized on the need for educational partnerships, full harmonization of training curriculum by all faculties of pharmacy in the African region in order to ensure production of pharmacy graduates that meet international standards. Workshop noted the need for a common pharmacy regulatory body to reduce bureaucracy in decision making. Professional collaboration in the health sector needs to be initiated among health-based students at the undergraduate levels. Adoption of technology in logistics and supply chain management of medicines will address the problem of uncoordinated drug distribution channels in many African countries. Thank you very much.
Thank you, moderator. Okay, là-bas. Hein? Là-bas. Thank you very much, moderator. Thank you very much, Arinola. Just a few words to thank everyone who has attended this meeting physically or virtually. Because how many people, Didier, how many people online? 400 people watching this program, this event, which is, I think, a fundamental event for our forum. We have chosen 3 topics, 3 themes, but we didn't know exactly what will be the outcomes of this workshop. We didn't evaluate, but I can say that this workshop has delivered a lot. Because when you see the topic, the technological innovation, you have a link with the pharmacy, the Association of Faculties. You need technology to upgrade, to educate pharmacists, to educate future pharmacists. You need technology, you need university to train and to educate pharmacists to vaccination. This is something important. And at the end of our workshop, I advise pharmacists to stop complaining. They should not waste their energy in complaints, to imagine the future of their work, their profession in this continent, to imagine how we will help the health system to improve. It is, for me, the way forward. The way forward is to look every day, to see every day what we have to do to ameliorate our profession, to improve our profession, to advance our profession. Thank you for coming. I want now to call Arinola. Non. Elle est partie où? Bon, okay, when she will come back. Okay, thank you very much.
Hello, bonjour. Now we will speak French. Vous allez bien? Okay, it was a wonderful. Okay, merci beaucoup. Merci beaucoup à tout le monde. C'était vraiment un grand plaisir d'avoir toute l'Afrique et tout le monde entier qui suivait cette conférence. Thank you to all the world and all the African Forum members and all the FIP friends and all pharmacists on the world and all the researchers and all the people who was following this meeting. Then I will take opportunity to present you again APF quickly, our forum, because the institution is important. Science is important, it's what we have done today, but institution to know what is IPF is important. The African Forum of FIP, the membership application, I am sure after this day, we will have more members because we already have members of various countries. You know the President Yagu just speak, the Vice President Jocelyn, she speak today, and me. And after that, you have the immediate past President Anthony Akimnen, the Chairman of the day, and then the Arinola, the Moderator of the day, and our Liaison Officer Richard Lenadou, past President of Benin Republic Pharmaceutical Society. And then it is very, very important because today we have all the presidents online. We have Mabel Torongo who create, Boniface Okwo Azubike, and then of course Anthony Akinen and President Yag. And then we are very, very, very happy about this day. And then we have all the press here. We have Clara Okoro, a consultant on NTA, we have ITV, we have Pharma News, we have Guardians, we have Pharma Times, all the newspaper, I forget, yes, and abroad, and Eco Santé in Cameroon, and many others. Thank you very much. And then the APF presentation, our mission is to increase partnership, dialogue, understanding and activity in matters relating to the practice of pharmacy and pharmaceutical science in Africa. It's what we do today. This is to enable the profession of pharmacy to have greater impact on the improvement of pharmacy service and public health by focusing on distinct local and regional needs. Next, what we want to say, le suivant. Okay, this is the contact. Our official address is PSN House. That is important because we are in the capital city of African Pharmaceutical Forum because PSN give us an office free. It's supported by Pharmacists of Nigeria. Thank you to Pharmacists of Nigeria for that. We have official office paid by Pharmacists of Nigeria to build Africa. To build Africa, that means what? We cannot stay and say we don't take opportunity. Everything in life is opportunity. Next slide. COVID situation is opportunity for Africa. I take plane to come here. It was very difficult because you have to do COVID test, you have to show the vaccination, you have to do the quarantine. It's very difficult. That means it's opportunity for Africa to grow its own industry. Because people cannot travel like before. That means all the countries have to organize themselves to save their population. And Africa have the best place because everything has to be developed. We have the raw material, the natural product. Our ancestors leave us a lot of secret. It's not all in the science. We will put it in the science. It's the role of our forum. We've seen that by the technology. We've seen that zipline, what they do in Ghana is fantastic with drone. And then APF strategic is to collaborating with WHO, plan and executive national plan, training and retraining pharmacists, as we will do for the vaccination, research and documentation. The professor said that is why it needs the Association of Pharmacists and Association of Pharmacy School to increase the participation in public health. We have the administrative pharmacist here, and then if FIP, I can give advice to all Africans to try to be in all sections in FIP. It's what I have done in my sector, it's industrial pharmacy section. I start when I was only 22 years. I was just making my study, I start, and now I am vice president of that section. But all the Africans can do that in all sections. I say, if you are in the administrative, you go in administrative. If you are in the community, you go in community, because they need the input of all the world to make growing our continent in the quality. Next slide. And then after that, what we do, next slide, is to say that we are very happy by the cooperation we do here. And then there is no border, there is no language border. We are coming from a country where we speak 2 languages. It's not perfect, but we are trying to speak when we can, but the pharmacy is only 1 language. And now we have 1 FIP. In FIP is the goal of the new president, Dominic Jordan, 1 FIP, and now the forum are the total part of FIP. It's a good opportunity for us. It's like the World Cup. That means in the World Cup, when a team going in the World Cup, you want to be like the best team. We are the best team together. All the participants are the member of the team. We cannot be team together, only the EXCO. The EXCO needs the participant, all the participants of this forum. We hope that you will become individual member of FIP, and we hope that you say to your country to make membership in APF. It is important, because without your support, we cannot do anything. Next, we will finish now for the current project. You have seen that today, the Association of School of Pharmacy, the access to quality of medicine device and services by the 2 presidents, the vaccination training, and the fight against substandard and falsified drugs. That is, that we have to never stop that. Next, and then it will be the end. Okay, then when you have to do the meeting, we do this general meeting every year, 1. The regional workshop is this one. We do the extraordinary meeting, and every month the EXCO do a meeting. And we organize many conferences and webinars. Then you will be aware, because this conference was seen by the advertising 50,000 persons. We checked it yesterday, 50,000 persons. 400 follow the conference, by 100 on YouTube, on Zoom, 200 by Facebook, and 100 by YouTube. That means it's a good start. We have to continue like that. Continue. Now it is the last AGM. It was in Abu Dhabi. You see all the people, many Nigerian, of course, like on all conference of FIP. And then we hope next time in Seville, next year, we will be many. Next time, next slide. Okay, who can join the FPF? Everybody can join by individual member. You can be individual member, and then you are active in FIP. When you are individual member of FIP, you can contact the APF and say, I want to be active. Then you can be active. But any association of pharmacists, any professional national pharmacy association can contact us to be active with us. You see, for example, on Empower, come and contact us to be a partner. Continue, the next one. This is the RIB. Okay, the country who are member of FIP from in Africa, we have Nigeria, Ghana, Cameroon, Zimbabwe, Benin, Kenya, Algeria, Uganda, South Africa, Rwanda, Tanzania, Ethiopia. I hope there will be more. Next slide. Yes, this is the RIB. That means what? RIB means if the country don't pay the due, if we don't have membership, if you don't pay your membership, the association and the APF cannot be strong. We need all the people to make effort to respect and to contact us to have to pay the due. Next slide. Okay, thank you very much for your attention, and then thank you, Arinola, to give me the floor. Okay, okay. I know you. It was a thanks. It was a thanks, but you can make down the vote.
Didier was looking for this opportunity. No wonder he didn't want me to forget him. He had prepared powerfully for the vote of thanks.
Okay, I was waiting for Arinola to conclude by asking you to stand for an ovation for her.
Thank you very much. Wow, that's overwhelming, most unexpected. Thank you very much, President. Thank you for the opportunity to serve. I live to serve. That's just it. Thank you so much. And so we're done with today's program. Thank you very much, everybody, for coming. Let me thank you properly, the way Didier should have. We're now going to go downstairs to take group photograph. Yes, downstairs. All the barriers in this place is not good for a group photograph. So we'll take the group photograph downstairs at the... Oh, what? That's true. We can take even the roll-up banner will not show by the time we are arranged. Huh? So thank you very much for everybody that has participated in this forum, in this workshop, both virtually and on site. We appreciate everybody. I appreciate President and the Secretary for coming all the way from Cameroon and the challenges of coming across the continent. I thank all the participants that joined virtually. And as I promised, I don't know whether it's a promise actually or a threat, that we will reach all of you. And we will commit you to one thing or the other on behalf of APF. And we believe that you will attend to our cries when we do reach you. On behalf of Sister Zita, I understand that those that are interested in the BEARS training can reach out to Dr. Okafo. Her email and phone number will be shared when we're sharing the details of the slides and video to all participants at this workshop. Thank you very much, everybody. So, cameraman, what are you saying?
The picture, you think we can do here or we go downstairs? We can do it here. Huh? Outside, yeah. But I think we have to do like this. Okay, let's go downstairs for the picture.
They want us to take pictures up here. So we'll just put some chairs here and then some people will stand at the back.